So I've taken a bit of your attention. So today I would just like to start from the question, like, how are you? And I know that everybody would have their own answer to these questions, but since everybody got here, reached out to here, and I'm hopeful that you even had enough sleep. So I'm hopeful that we can, with the burning eyes in a tingling sensation, we are entering the 3 days that are starting off and would be saturated with a wonderful line of work, with wonderful discussion, with the fruitful topics, wonderful and tasty coffee, pictures, and discussion of what everything that we are lacking usually. So take a rest, put your thoughts aside, and concentrate on wonderful lines of work and good times sake. So we are beginning our forum on mental health, and to mention it more in detail, this is the first forum on mental health that Ukraine is hosting, and movement to the services and capacity for future or modern mental health system. Mm, And I know that you probably mentioned that as of today, in our reality, we are adapting to different situations, and we have also adapted for maybe it taken for a bit longer to take the registration or shorter. We will change the beginning, but this is not going to influence to the events that we are planning for today. This is why I propose to start our first welcoming panel, and for under your applause, I welcome our guests. Irina Vereshchuk, Vice Prime Minister, Minister for Reintegration of Temporarily Occupied Territories, and co-head of Interdisciplinary Committee and Working Group on Mental Health. Viktor Lashko, Minister of Health of Ukraine, co-head of Interdisciplinary Coordination Board on Mental Health. Dennis Brown, Coordinator of UN System in Ukraine, and Humanitarian Coordinator. Yarno Havik, WHO Representative WR of WHO Office in Ukraine. And also Jeffrey Werer, Acting Director and Deputy Mission Director of USAID in Ukraine. Ladies and gentlemen, thank you so much for joining us and you're opening this welcoming panel. This is why, Irina, let's start off with you. Thank you so much. Can we sit? Can we do so by sitting? And okay, greetings everybody. And I would just really like to start from how are you? This is the really valid question to be presented regarding mental health and the program that we will be mentioning today. I think this is highly important. First of all, thank you to organizers and to Ministry of Health and to WHO as well to implement, to do better best practices and to help our institutions to work in this area work, because the war forced us all to have a different look, both in general and from each and every one of us, to have a different look on mental health issues in validness. I have personal experiences in this. I mention a lot, and I will not get tired speaking about mental health, that we need to have a public discussion, and that we need to have any ability to bring to the public issues of mental health by supporting and helping one another, by understanding that this is how the resilience of the nation and resilience of the country will be built. Thank you to the First Lady, to Olena Zelenska, for leadership, for her actions and her words that she did in the beginning last year. She's given us a push. She's given us everything that we would need to have so that the mental health program would not only live or exist, but also to be developed in each and every ministry, in each and every central executive body, in each and every community, in each and every local executive bodies, wherever people are making and bringing decisions to life for this program to start to live and develop. This is why respect to Olena, and I would just like for us to give her a round of applause for this insurmountable amount of work. Thank you so much. I would also like to say thank you with this these workers to our mental health center under cabinet ministers of Ukraine, because they are the driver and the engine of all of those matters, of all of those steps that our ministries are doing and government in general, and the prime minister and everybody who in the government is responsible for mental health. Oksana, Irina, and thank you all so much for this, because we would not be able to achieve anything if it wasn't for you. And also just like to say thank you to my colleague, to Viktor Lashko. Together with him, we are co-coordinators of our coordination board that is acting and that is working and that is collecting, coordinating, and developing in each and every area, because each ministry has their own responsibilities, their own priorities, but they know for sure what and how to do. So just really like for this to be developed in the fruitful area in this way and with such a drive forward. And unfortunately, the war is not yet ended. Our resilience and personal and the national state resilience is there, but it always requires daily line of work for it to be strengthened and going to victory. Glory to Ukraine. Thank you so much, Irina. Viktor Lashko. Thank you so much, and I wish you all well. And a few years ago, when we worked on the draft law on the public health system, and we were mentioning that mental health is a portion of public health, we were not understood by 90% of people who we've discussed with or talked to. Now, when I'm looking at the hall, when I'm looking like on how mental health issues is brought up at the level of the government, what I can say was optimism to look in the future, because as of now, the person that doesn't believe that mental health has to be given enough attention, I think that there is just a lack of, and those are not the people who are with us on the team. Therefore, I am so grateful to our First Lady, Olena Zelenska, that on that level believed in and taking this flag that she brings forward to change the understanding and approaches to mental health, both her own and in public health, when we are saying in general for the country, and moving also forward. And there's so many international colleagues with us, because mental health is a challenge in the whole world, and we need to show but to set an example, resilience, sustainability, and the ways and how we can solve them, and in our own experience, and unfortunately bitter experience, but we do have to give experience to other countries for them to build their own programs. Ukrainian program, How Are You, became the fundamental backbone, like how in a crisis, rapidly, in a quality manner, to rule out all those issues by solving it with the least harm for your overall health. So for everybody who doesn't yet believe, please remember, what do you remember about mental health a year or a year and a half ago? Usually people thought that it was usually anything about self-diagnostics. Can you decipher a psychologist from psychiatrist? Did you know that the family doctor, psychologist is nearby, social worker, and not just the hospital with the penitentiary service, essentially, with the white cloak and what Soviet heritage brought to us when we were mentioning about mental health support and psychiatric care support. We have a big number of issues that we have to go elbow deep in, but each and every area of work know what has to be done. And our objective in such a forum objective is to have the horizontal level of cooperation, so that we would know where somebody has to be referred if that level of care is not able to provide care for, so that what person needs, not that they can give that person, but what does this person need. And this is like a key thing that we have to do at this moment. Therefore, we have this coordination center, and so this group that we are co-heading with Irina, and the Center on the Cabinet Administrators that speaks about interdisciplinary cooperation. Right now, no area can do this alone. Only by coordination and interdisciplinary interaction can reach the results. I am so grateful for finding the time to come here physically, to speak up about the problem, and for the experience that you will get. We will get a lot of the leading speakers and the specialists that will be sharing their experience, both the positives and the negative examples, because you need to learn not only on the positives, you need to learn also on negatives, and what you don't need to implement. And we started to work on the program from the list of what you don't need to implement in Ukraine, because somebody tried to do that and there was no positive results. And this roadmap is noted down in the list of interventions that we will not implement, is also known to us. So I'm so grateful to everybody and so grateful to our international partners. They are standing hand in hand in all of the issues that we face and are moving to the capitulation of Russian Federation. Thank you. Thank you, Victor. It's a wonderful speech. I welcome to the floor Dennis Brown. Please, Dennis, the floor is yours.
Good morning, and thank you very much for another really important opportunity to discuss mental health. And thank you to the First Lady for her leadership on speaking out on an issue which is often hidden and stigmatized, and to the Prime Minister, the Vice Prime Minister sitting here, and the Minister of Health, and dear Jarno from WHO. Every morning, so I'll share something with you. Every morning at around 5:45 a.m., I go out and walk for about 40 minutes. It can be raining, it can be snowing, there can be an air siren, doesn't matter, I'm going out. Because I also have a lot of responsibilities in Ukraine, and I'm not Ukrainian, but we are affected by this war, similar to the way Ukrainians are. So I need to take care of my mental health. And so I do that every single day. And so this morning when I was out, I was thinking, what would I like to contribute to this conversation this morning and as we move forward on this very, very important topic? And the first one is the approach. Mental health is complex. It's not like repairing a house that's been damaged in the war. We can repair windows and doors in the same way everywhere across the country. But you can't approach mental health in the same way for different people in Ukraine, right? There needs to be a much more nuanced approach. We also know that no single approach to mental health works. Everything depends on the severity, it depends on gender, it depends on age. And we also know that we can't wait until the end of the war for mental health to be addressed in Ukraine. So there are so many different aspects to look at when we're approaching mental health. And then I was thinking this morning, yes, but the gender aspect. We need really to dig into the gender aspect of mental health. Women tend to be the caregivers, no matter where we are. Across the world, it's the same. Women are usually at home or at schools, in the hospitals, taking care of others. When you're so busy taking care of others, you're not really taking care of yourself. So the burden on women and their psychosocial well-being, I think, is something that we need to look at more closely. But it's also true for men. And men tend also to hide this because of the stigma attached to it. So many issues with regards to gender that need to be looked at much, much closely. And we know that gender-based violence, it's an issue all around the world, but in Ukraine with the stress, it is increasing. So again, something that women have to deal with. On Saturday, I was in Chasiv Yar, Donetsk, and it was the first time we were able to deliver there since May because of the fighting. So we had the authorization from the military to go. It was incredibly stressful. But people were still there. People are still there, living there. And when I asked one man, but why are you still here? It's so difficult. He said, because my life has purpose here. And that's what's so important for our mental health, that we have purpose. And he has purpose even in Chasiv Yar. But what we need to do better, and I think that's a challenge for the group over the next few days, we can deliver humanitarian supplies, but we're not delivering services. So we took for people's physical needs, but not for their psychological or emotional needs. And I do think we need to figure out how to better make that connection. Also, the displaced population. They're safe in the centers in which they're living or people's homes in which they're staying, but they're separated from their day-to-day life. So there's a kind of a grieving process going on that also needs to be addressed. And again, supplies are being delivered, but services are not being delivered. And I think in the humanitarian community, we need to do a much better job of taking that additional step. But that's something I think we need to build in to the roadmap that the minister was talking about. I'll just finish by saying this is an issue to be addressed now, which you are doing, and it'll take a long time. Partnership, cooperation, the approach, the tools, knowing what's going on and knowing where to fill the gaps are extremely important. But with this huge humanitarian response that we have between the local actors, the national partners, the internationals, there really is an opportunity to contribute to supporting people's mental health needs in such a terrible, terrible situation. So when we ask the question, how are you? Please also ask yourself, how am I? Talking about yourself. Take care of yourself. It is extremely important if we're going to be able to take care of other people in Ukraine. Thank you. Дякую.
Дякуємо. Thank you so much.
Слово має Ярно Хабіхта.
The floor is to Jarno Kabikt.
And it's a great pleasure to be here with you. And good morning for those who are in this room. I see that there are more of us than actually seating places. And I like to also welcome everybody who follows us in virtual forum. I like to thank the co-panelists here, especially Irina and Victor, for the leadership you're giving to mental health. And please pass that also to the Prime Minister, to the First Lady, Olena, and everybody, because that's an important. And it's not many places where we see that actually the whole government comes together, the whole society comes together, and there is a leadership. So I think one key aspect why we are here today and talking about mental health is because Ukraine has taken the leadership to address mental health. And that's very, very important because it's not always happening and it is not happening by default. I like to thank also Denise because she has a number of priorities always, and United Nations and all of our big family, we work on many things as she was also sharing experience from the field. But she always prioritized the mental health, which becomes also an important for the whole UN, not only for WHO or a few of us as an agencies. And I like to thank also Jeffrey here from USAID, but we have many of the partners who are also supporting Ukraine. So I like to see that we discussed about mental health last year in March and April, after what we have seen when Irpin and Bucha and Makariv have been liberated, and we saw the devastating effect to people who wanted to go back to home or who were there. And as Denise was saying, they had a purpose and they want to have a purpose, they want to live. We saw the need for mental health and the support. And the leadership was there, and today we are coming here together, hundreds of us, specialists from different corners of Ukraine, to think what we can do more, and we are here together for next 3 days. And this is also happening because you have an engine that keeps it going. And Irina was mentioning it already about the All Ukrainian Mental Health Program, but I really like to thank Oksana and the team. There are a long list of names, so if I count every name, probably we will go over the time. But that engine is extremely important, and we are here as partners and others to ensure that that engine is oiled, has good advice. We bring the evidence. We have a number of colleagues and everybody visiting Ukraine and supporting. But that engine needs to move ahead, and we are here to keep that engine moving in the coming years, because the mental health needs, as we see that, are there not for today and tomorrow. At least personally what I see, and when I have been discussing with experts and visiting community mental health teams in Kharkiv or in Ivano-Frankivsk, or we were in Dnipro, or many as well in Odessa, they all say that the needs will be there for a long term. And this will be there for not long term, for next year or 2 years. It will be for generations to come. And not only for those who are in Ukraine, but we should think also about those Ukrainians who are outside of Ukraine and about their mental health. And that's why the program that Ukraine agreed last December was really important, that it was for Ukrainians everywhere. And that is another innovation that Ukraine has, that you look for everybody. Of course, there are a lot of partners, and there is a lot of coordination happening. We have more than 300 partners who are working together on different tools, including MHCAP and Self-Help Plus. We have National Health Service, we have many healthcare providers. We have a lot of those who are making it happen. My colleagues prepared a list who I should mention. Sorry, probably I'm not following very well my speech, because mental health is something that it is close to me. It is close to also Tedros, Hans, the whole WHO team, to support Ukraine as much as we can as now. There are also areas that we don't know yet, because Ukraine goes through the path at the time of war, and we have just passed the 600 days mark, that we don't know exactly how to address all the aspects. And that's why I like to also thank all the researchers and specialists who are coming here to discuss. And this is the conference where we can find also solutions and later on share it with the rest of the world. And what is important is that we discuss about Ukraine in Ukraine. And that's also very important. I have seen so many discussions. I was just 2 days ago in the World Health Summit in Berlin, where we discussed also about global issues, global health matters, including about Ukraine. And some colleagues came and asked how it is in Ukraine. Should we come to Ukraine? We would like to organize something for Ukraine, but somewhere in Europe. I said, guys, if you want to talk about Ukraine, you talk about that in Ukraine. And that's very, very important, because that helps also us to be present, to discuss and see how we can go further. So really, the leadership for mental health, it's there. I wish everybody the energy that it will continue. The partnerships are there to support Ukraine. Your strategy, looking beyond Ukraine as well, on mental health is extremely important. And I wish everybody a lot of energy to move ahead as we are progressing. Good outcomes from these 3 days, a lot of the discussion, but be solution-oriented. And I hope that this meeting really becomes annual. And in our team, as Alisa is leading our mental health team, I know that we had that dream since 2016 to have annual conferences on mental health. And it has been sometimes difficult to bring everybody together. But I think now it's the time, it's the first, and I wish that in a year's time, we are here together. We talk about the second, then the third, because this energy that you are bringing to this room, the knowledge that you are bringing to this room, helps us to move forward. Thank you. Дякую.
Дякуємо.
Thank you very
Thank
much.
you, Jarno, for your words and your
Thoughts, really appreciate it. Thank you. Слово має Джефрі Лерер.
And now the floor goes to Jeffrey Lederer.
Доброго ранку. Vice President Minister Vereshchuk, Minister Lyashko, World Health Organization Habicht, U.S. Resident Coordinator Brown, Oksana Zbitneva of the National Coordination Center for Mental Health, and all of you here today. It's really exciting to be here on behalf of the U.S. Agency for International Development and USAID. This is such an important event, and it's quite impressive, the leadership with the government, with the international community, and first and foremost, with all of you to be part of this important venture in all of your work in mental health. The United States is committed to supporting Ukraine as it moves toward its future despite Russia's war. When your mental health is suffering, it makes it difficult to participate in the political, economic, and community life of your country. And that's why mental health is the key for Ukraine to be able to realize its future. That's why we're partnering with First Lady Zelenska and her team, with the Ministry of Health, with the Ministry of Reintegration of Temporarily Occupied Territories, and with other partners to help Ukrainians cope with the mental health impacts of Russia's brutal and unjustified war. The U.S. Agency for International Development, USAID, has supported mental health programs in Ukraine since 2015, and by scaling up new models of mental health, such as the Common Elements Treatment approach, often referred to as CETA, and developing a more responsive, accessible system of mental health care. We currently directly support the First Lady's mental health initiative through our Public Health System Recovery and Resilience Project, which is here today, a number of our other programs as well, to ensure that all Ukrainians can receive the care they need, from defenders returning from the front lines and survivors of violence, trauma brought by Russia's war, to people with disabilities and people returning from refuge overseas. USAID is working with the Ministry of Health to strengthen the Lisova Polyana Veterans Hospital in Kyiv to serve as a national training hub for much needed psychologists and psychotherapists. And we are now helping Ukraine develop community-based, people-centered mental health services across the country in close collaboration with the First Lady's initiative. We also support the How Are You communication campaign with the First Lady, which helps raise awareness about mental health, works to destigmatize it, and helps empower people to seek the help they need. I hope that this campaign enables all Ukrainians to more honestly answer the question, how are you? And if the answer is not okay, I hope that people will go ahead and reach out without hesitation to find the support and the resources they need. This is something I really believe in on a personal level as the son of a mental health professional. My father's a psychologist. I've grown up hearing about the importance of stress management and how important mental health is for all of people's lives. And so it's really important, all the work that you do, and that it's important for all people to seek the help that they need. But of course, we can't talk about mental health without also talking about the organizers of this conference, the World Health Organization. Very grateful to you. And your team. And USAID is part of the World Health Organization's special initiative on mental health, which provides crucial support to the government of Ukraine to coordinate and harmonize the efforts of these partners. And together we strive to enhance the mental well-being of Ukrainians, supporting them to overcome the hardships of the war, return to active life, and rebuild their country. Mental health of Ukrainian citizens is and will remain as important as physical health to ensuring Ukraine's free and prosperous future. But to truly meet Ukraine's needs, we must be steadfast in our commitment, which is over the long term. The United States stands together with Ukraine, and we are committed to continuing to invest in Ukraine's mental health needs. Thank you very much. Дякую за увагу. Слава Україні!
Ну і звісно, всі ці оплески для вас.
And this rapturous round of applause is for you, ladies and gentlemen. Thank you very much to our speakers for having opened this forum. Thank you for being with us, and thank you for paying care and attention to all Ukrainians, every and single one. Thank you.
Ну що ж, пані та панове, давайте звіримо годинники.
Ladies and gentlemen, let's look at our watches. Literally, 10:34. At 11, we will begin the next part of our forum here on the stage. So we will have a short break right now. If you didn't have enough time to have some coffee in the morning, you have a great opportunity to do so. If you haven't got registered yet, please do so. It's not only about getting a badge as a reminder of this forum. It's important that you have badges on you. So if you haven't registered yet, please do so. And be back here at 11 a.m. sharp. No delays, no being late, please. Enjoy your coffee.
Вибачте, але це не до нас. Це до іншої служби.
We are very sorry, but we're not really the right place. You should approach a different service.
Робіть офіційний запит.
You have to submit an official request. We do not give out any personal numbers.
Вибачте.
I'm very sorry, but my working day is over.
Ваш дзвінок дуже
Your call is very important to us, and we will definitely call you back.
Будь ласка, продовжуйте приймати препарати.
Please just continue taking the drugs prescribed by the doctor.
Вибачте, це не до нас.
Будь ласка, продовжуйте приймати.
We are very sorry, but we're not the right place. Approach a different service. Just continue taking the drugs prescribed by the doctor. Just continue taking the drugs prescribed by the doctor. We are very sorry, but we're not the right place. I'm very sorry, my working day is over. Make an official request.
Вибачте, але це не до нас.
I'm very sorry, but we are not the right place. Approach a different service. Just continue taking the drugs prescribed by the doctor. I'm very sorry, but my working day is over. Make an official request. Just continue taking the drugs prescribed by the doctor. Please continue taking the drugs prescribed by the doctor. I'm very sorry, but we're not the right place. Just approach a different service.
Продовжуйте приймати препарати, які прописав вам лікар. Будь ласка. Як я можу?
How can I help you? Unfortunately, there's no sound. I dreamt of learning something in this world. I wanted to become a star and I wanted to make a lot of friends. I was in Nova Kakhovka. I laughed a lot. I talked profusely and I would skate. At the age of 13, I became a child of the war, but you will not hear a sad story. You will hear a story about a strong Ukrainian teenager. An occupied town is all about isolation and uncertainty. Shellings and missile strikes are all about closing your eyes and not forgetting to close the door. And you also don't want to forget to tell your family members that you love them. The war has taught me to indulge in little life's pleasures. It's all about favorite hobbies and people. I started volunteering for an underground non-governmental organization. We would distribute medications and food products to those people who could not go out to streets because they were not safe. Food stores and groceries and also drugstores shut down. And I could see boys and girls sacrificing a lot to lend a helping hand to an elderly person or a child. I've seen adult people sacrificing themselves for the others or those surrendering other people. Right now, I live in Odessa. My sister is doing her studies in Lviv, and my dad is under occupation to support his parents. In the new city, there's a new version of myself because everything around me has transformed. And it doesn't really matter how many years you were a previous person, you will never be the same. It's all about worries and concerns, whether I'm doing everything right, whether it's for me, whether everything will be fine. What would a 6-year-old me do? She would go out to a street, she would dance to the same song, and she would just draw and draw and draw. But I'm not 6 anymore, I'm 15. I have grown up. It's a prerequisite for physical and mental survival in times of war. On the 24th of February, during the first explosions, our childhood was over. And now it's all about risks, adaptation, and care for your dear ones. Another challenge is to understand what the word growing up means to start with. Does it mean to have a more serious attitude to your mistakes? Does it mean not to stick out? Is it all about responsibility for your actions? I guess I agree only with the latter. A year ago, I joined my first online program for teenagers. I got in contact with peers and I found out about project management. I came to know teenagers who create NGOs and they create their own volunteering stories. You don't have to wait for a university, you don't really have to have a career, or you don't really have to be of a certain age to transform the world around you. The civic activities that I'm engaged in do not distract me from the war. I have this awareness right now that it's here and now that we have to act and we have to become kinder towards the world. Ukrainian teenagers are not fearful of articulating their opinions. They have their official stance and they are fighting for their country. When the world is asking you, who do you want to be in the future? You need to think and answer who you are right now. What am I doing for my environment? What am I doing for my country? What am I doing for myself in the first place? What is the purpose of my actions and behaviors? Am I happy? So many questions circulating in my mind. For the world to change, you need to make your contribution, minuscule contributions. you should not be fearful of doing something yourself. You need to broaden your horizon. You need to do everything within your capacity to this end. Volunteering is something that provides you that. Because if you are a teenager, you always think that you're not doing enough. Active young people are doing colossal efforts for our military and for our future. I'm developing and growing in multiple sectors. I'm harping on my soft skills. I continue smiling because this way I feel important, extraordinary, and normal or ordinary at the same time. Self-development makes you think about your values. You have some time to yourself and you can reflect on each and every part of yourself. I apply for exchange programs. I participate in projects. I would burn out. I would be part of toxic companies and programs. I had faith in my dreams and I inched closer towards them. But in times of this full-scale war, day in, day out, we look back and we want to be back to normal. But once again, it's all about transformations and motivation for creating the future. Despite the challenges, continue self-actualizing. Pursue your goals, shine. This is something that I've realized this year, that there are plenty of evil people in this world, so we need more sunny thoughts. What are people so afraid of behaving like children? A 6-year-old Violetta would laugh a lot, she talked a lot, she would fall and be back on her feet. She wanted to explore the world and change it. A lot has changed since that time, but not this, because we are forging our future ourselves today, here and now. This is my experience, and this is my key message at the opening ceremony of the Mental Health Forum. And I'm addressing those who want to create and implement change. I believe that if you are not like others, if you love what you do, you will be able to soldier through the tough times. For me, mental health is about resilience in the first place. Thank you. Thank you. Give a rapturous round of applause to our performance team and to Violetta Gorbachova from Nova Kakhovka. Fantastic Ukrainian youth. I think you will definitely concur with me there, right?
І давайте, от вже побігли. Театр
In Malanka Theater, give your rapturous round of applause to them as well. Goosebumps on my skin. Thank you so much. If you have TikTok, you definitely know about the Malanka Theater. If you don't know anything about them, it's a Kyiv-based theater. Definitely visit them and find out more. Ladies and gentlemen, I really hope that you're not really shocked by the second part of our forum. Are you? Well, I can hear this pin-dropping silence. Let's clap our hands for one another, because we will continue in a more laid-back atmosphere. My name is Timur Miroshnichenko. It's a great delight of mine to spend this day together with you. It's a day that will be prolific, fruitful, and saturated with multiple diverse events. But most importantly, we just need to have this day carved in our memories. All the events will be taking place here in the main hall. And this main hall is tantamount to a bomb shelter. So if there is an air raid alert, and I really hope that there will be none, we will not really have to rush anywhere. We will not really put a pause on our work because we are already in a shelter. So no one and nothing will be able to impede our fruitful work. What else should you know today? We have a packed agenda put together for you. We will have a multitude of speakers on this stage. We will also have Q's and A's from the audience, but the bulk of our speakers today, tomorrow, and the day after tomorrow will be physically present in this hotel. So you can also write down your questions, make a mental note about them. You can approach our speakers behind the scenes during coffee breaks and lunch breaks, because your active participation in this forum is paramount to us. Tomorrow, we will have a wide array of workshops and other sessions, and you will have a great opportunity to articulate your advice, reflections, observations, so you can be fully engaged in all the processes that are part and parcel of this forum. I really hope that this information is obvious and easy to understand, but give me a round of applause to testify to that. Okay, now I have confidence in the fact that everything is clear. So let's continue. And now we will have a more extensive conversation about the all-Ukrainian mental health program initiated by First Lady of Ukraine, Olena Zelenska. And I would like to invite up here Oksana Zbitneva, head of the Coordination Center for Mental Health at the Cabinet of Ministers of Ukraine. Ms. Zbitneva, the floor is yours. Thank you, Timur. Greetings, everyone, colleagues, friends, partners. I'm addressing those gathered in this hall, and I'm also addressing those who are watching us online. This forum has brought together all the representatives associated with mental health. We have those making decisions, and we have those bringing them to fruition. We have those who are the centerpiece of the system, that is service users and service providers. The All-Ukrainian Mental Health Program set a very ambitious task, the task of uniting all these stakeholders around a shared purpose, so that each and everyone who is recovering post-challenging experience with mental health disorders or lack thereof will be able to achieve their own level of I'm okay, I'm fine. I suggest that we watch a video clip.
Я думаю, ми спробуємо спочатку.
I really hope that we can start all over with sound on, because it's very important to be exposed to the emotions and the energy. I guess the emotions and the energy are so immense that even our technology is failing us. How are we doing with sound?
Привіт, ти як?
Так як всі.
Привіт, ти як?
Ну, коли я працюю, в принципі, то я завжди зібрана, щоб там не було.
Привіт, ти як?
Працюємо.
Ти як?
Тяжко хочеться до рідних, до сім'ї.
Ти як?
Я сам тримаюся.
Привіт, ти як?
Нормально, звикаєш потрохи.
Ти як там?
Все добре, тільки додому трішки хочеться.
Привіт, ти як?
Важко сказати.
Привіт, ти як?
Останній час, звісно, важкувато.
Ти як?
Війна триває і треба перемагати.
У цьому ролику діти.
This video clip depicts children who underwent psychological rehabilitation post-bereavement. And you also saw the military who are fighting at this very moment on the front lines. And owing to them, we can be here today. We have this amazing opportunity to gather in this hall. The former embody the future, the latter are getting it for us. And I suggest that we clap our hands to express our profuse gratitude to all the military.
Слава Україні!
Glory to Ukraine. Glory to the heroes. These are our two top priority target groups whose eyes have seen so much pain, anguish, and suffering that they also create a bridge between themselves by asking a very candid question, how are you? And they should be the point of gravity for all the mental health related services, recovering, accepting, and integrating people with challenging experiences. This is one of the challenges facing in front of us. After the victory, the need will be ever grown. We need to do everything within our capacity to prevent mental health problems and disorders where it's possible. Every second person is in a risk group. It's all about economic risks associated with post-war recovery. There are also risks associated with the critical overload of our services and the collapse of the mental health system. The focus on prevention should be maximum at a teen age, where 70% of all mental health disorders get manifested. According to the findings of the sociological poll conducted on the occasion of the third summit of First Ladies and Gentlemen, teenagers assign the lowest score to their mental health. Hence, Violeta at the opening of our forum. and most of them require additional support. At least 180,000 combat veterans also have a need for psychological support, and this figure will continue growing post our victory. It's essential to accept and integrate heroes with a very tough experience. This is part and parcel of this support. And to this end, we need to engage our entire society. We also need to achieve internal changes within each and every one of us. The data testifying to the level of need can be discussed for hours and hours, but what is the response that we can offer right now with the existing system? To rely on facts and reality, we conducted an audit of available resources, and the audit demonstrated that mental health services are primarily focused on those who already have pronounced mental health disorders, and these are people with severe forms of depression and alcohol and substance addiction. Inpatient care for such people constituted 88% of the total mental health budget. The audit demonstrated that those services that existed before the 24th of February, as well as those services that emerged as part of the emergency response, are not part and parcel of the system. And if there's no system, then it's impossible to manage the process and the effectiveness of services. As a result, the services emerge in a reactive manner. They are fragmented and they have poor effectiveness. And I think that the Ministry of Health and mental hospitals would remain in the consciences of many people as synonyms to mental health. But now we have this new reality, enormous distress of the war. This is something that impinged on the entire society, and as a result, we have to seek new solutions, systematic, multi-level, and multi-tier. The First Lady of Ukraine, Ms. Olena Zelenska, gave impetus for the profound transformation of the mental health system. The boldness of transforming the system in times of war is an enormous driving force behind the all-Ukrainian mental health program and everyone associated with the program. The program initiated by the First Lady consolidates the efforts of all stakeholders in creating the system of accessible, high-quality, and barrier-free services and cultivating a culture of care for mental health. In May 2022, we established an interagency platform for crafting joint solutions on supporting the mental health of our population. This is the Interagency Coordination Council that is usually chaired by the Prime Minister of Ukraine with direct participation of the First Lady. This council became a genuine space for dialogue and idea generation. And this platform was important to manage the multitude of initiatives and activities generated as a result of this initiative. In March 2023, we also established, with the support of WHO, the Coordination Center for Mental Health at the Cabinet of Ministers of Ukraine, and it provides expert support for the implementation of all the focus areas of the All-Ukrainian Mental Health Program. So basically, the soft power of the First Lady's leadership opens up new opportunities for Ukrainian professionals. It's all about experience exchange and training, implementation of best practices, and joint research. We are creating global and highly specialized projects. It's all about peer-to-peer training, innovative techniques for working with PTSD, and etc. The topic of mental health has become not only a priority of public and regional policy, now it's the centerpiece of international platforms. And the third summit of First Ladies and Gentlemen that took place in Kyiv on the 6th of September centered around the advocacy of mental health at global level, the scale that was inconceivable and unfathomable 2 years ago.
As for this summit, the sociological survey was conducted in 11 countries. The results of the survey confirmed that the people around the world see mental health among the highest priority of public health policy and social debate. Every second respondent feels the impact of war on their mental health and for being thousands of kilometers away from hostilities. And also, even being thousands of kilometers from the places of action. Implementation of a large-scale transformation is impossible during war without impossible without reliable partners. With words of gratitude from all of the international partners and organizations of governments of countries that provide assistance to Ukraine and give us the window of opportunity for the strategic and systemic changes. And a huge thank you and gratitude for support of the implementation of those changes as experts, as managers, as donors. Due to the leadership of the First Lady and the support of the partners, the All-Ukrainian Mental Health Program embodies decisions that should consolidate the resources and potential of all systems and all stakeholders at all levels. And so the program has 7 main target groups, the most vulnerable to war and the most important for the future of the government. They and their needs are the backbone for any decision-making process. They answer for the questions, and it's all done through the ecosystem. As the center of that is the person who is the procurer of services. Central executive bodies as the policymakers, regional authorities as managers and implementers of services in the regional level. Businesses as the big employers, international partners as the experts in financial support, NGOs as services providers, expert and scientific community as the leaders of the innovation, and the responsible customer is done by the high quality psychoeducation and mental education to do and I'm so grateful that all of the representatives of this big ecosystem are present in this hall, almost all of them. By joining our efforts in this ecosystem, all the stakeholders, the Ukrainian Program for Mental Health has to cover all the continuum of those states, from both from health to chronic conditions, and the full spectrum of intervention, from prevention to rehabilitation and to response in emergencies. The audit has stated not only the absence of the system, but also highlighted the most issues in those sectors in the healthcare system, economy, education, sport, culture, information policy, the security and defense sector. So the answer to those questions are the priority projects of ministries as an answer to identify gaps there, strategic decision, and the quick steps to stabilize the situation in front of us. It's nice to state that as of now, there's almost no state policy area where there's left behind that was no mental health projects or initiatives. Some of them are more extensive, some of them more specific or more targeted, but by going together into ecosystem, they cover all direction, and they have the first successes along the implementation as of today, as of tomorrow, and on those days we will be mentioning today. Regarding the implementation of the priority project and all the changes on the systematic level, there's a line of coordinators, and this is the communication channel spreading out the best practices, experience exchange between the regions, merging together all the partners on the local level. And if you are already working in the regions, please get in contact with the regional coordinators of those programs. They're just finishing mapping of the services that are found to each community level so that you would not just lose one another. But it's good to remember that the initiatives that have to be implemented in the real ways forward to the build-up of services in the communities in where the person is resident at. And those are the services that activate the social connections, involved internal and external resources for the recovery process and reintegration of the person in the society. The main area of work and development in the mental health system in Ukraine. To understand in a better way the resources in need, we conducted a survey all over Ukraine in all the regions. And so this survey had 14,000 participants as both services users and services providers. And so we see that there is an increase in the load in every sector of experts that can actually create the request for the services and the needs among providers for support programs of additional training. They have to be dedicated for them specifically, for the ones who are working as the peer-to-peer or person-to-person interaction. The basic scale of mental support is also forms the conscious and aware community for experts to provide services where the person is reaching out to the state services and state systems. And the survey showed the correlation. If we are achieving new knowledge, we have certainness and knowledge that we will be able to provide a quality service because of the partners. Such skills were received by 400,000 people throughout Ukraine. Among them, family doctors, education experts, policemen, business employees, and others. Regional coordinators are just a part of the national team of coordination that has been represented on all of the levels. It has been included by the central authorities, international partners, regions, communities, armadas to the joint discussion for the implementation of national-wide mental health program, and on coordination as a special aspect will be mentioned here as well. The next step is movement from the absence of system to systems establishment of the system that will bring up the person from the birth and will support the person throughout their life and will aid them in the usage of their personal resources. And this was our vision in the first steps and of the vision that presented in the beginning of this year, but now it has deeper roots and is the product of the strategic scale and is the movement from the reactive to proactive, barrier-free, and prolonged solutions. And so they will consolidate resources and they will get their resources together and will be based on the quality cooperation and interaction. A lot, and in between, those are some multi-layer, multi-level, multi-component, intersectoral, interdisciplinary, and merging those resources to cover up for the challenges appearing due to the war in Ukraine. And so there are a needed language and the terms for the system to be established, for the system to be able to respond to all of the challenges and provide care for everybody who needs it. For the system that prioritizes prevention of mental health issues, establishment of accessible services, and promotion of mental health and mental well-being. The vision of System 2.0 based on the analysis in audit and will be the background for the future creation of the state policy in every existing sectors of the state service. Mental health in every policy, which is the key thing here. The number of strategic documents that were processed or renewed throughout the year will take into account every priority area work and dedicated to its implementation. There's also the government action plan for the future 2 years and also roadmap and multi-sectoral areas of work for psychosocial support in Ukraine during and after the war. Among the challenges that this new system has to keep as their highest priority, the top level spread on the primary mental health support and also other types of support, additional qualification of experts in the evidence-based approaches to treatment, standardization of services and services providers in mental health. And I can also reach out to all of you, to all of the services providers. Do the audit of your services. Do the assessment of the availability, coverage, and quality of services to integrate into the system, provide for sustainability and capacity. Communication campaign, How Are You?, which is one of the key portions of the Ukrainian mental health program, which is a big awareness-raising campaign to find Ukrainians their own resources and power to conquer stigma and start speaking about the things that have been a taboo for years, to create a new culture that serving for mental health is a daily routine. At the beginning, it was important to make sure that the people understand that this is possible and this is needed to be current, to be needed at the time. First Lady reached out to Ukraine. It was the question, how are you? It was the simple and a deep and profound question, because from this question we are starting this morning after the Russian shellings. We are writing this to the person that's close to us on the front lines by hoping to have I'm alive. How are you is everywhere. People are reading it out in the media, on the radio, see this on the TV, and the city lights of their cities, at anywhere they can be. But what else when you've answered on how are you for yourself? If I'm not okay, like how can you change it? And if it's all okay, what can you do for it to stay okay or to help the close ones to restore the resource? 70% of people, based on the assessment of experts, can actually do the self-service if they would be able to have the skills necessary for that and would get the support and the close circle psychosocial support. This is why the next step of the campaign is to make possible the tools for the support for people. And how are you finds the implementation different formats, different products as the key for the heart of different audience, different people. Right now, the focus of this campaign is parents and children. Apart from those recommendations, there are contexts of supported partners and the hotlines on the mental health support. Thank you so much to all of the partners who are creating really quality services and quality product. Thank you to USAID, UNICEF, WHO, International IOM, and for join to this big social transformation. And for those few months of the activity of communication campaign has been all covering. And so from the March this year, we have brand recognition, 25% of population. This is a new level of discussion on mental health in Ukrainian society. The campaign was supported by businesses, the one who understands that in the human resource you need to invest. The brand How Are You can be seen in the cargo parts or in the cars of the trains, at the cashier stops or checkouts, and the like stores, and even in the ATMs and the bookmarks or anything else. So everywhere, the culture is an important voice of message spreading and manifest of the importance of listening to you and to your mental health status. I would propose to you to go in depth with the musical manifesto and to let it through yourself fully.
Ти як? Посеред
How are you during the ocean of pain? Do you have the efforts to still swim? Do you have the capacity to move into the peaceful world? Can you still go through all of the losses? Can you still do and have everything else in this? Whenever we didn't want to go through the terror. We never thought that we wanted to be compared by the sick bloodhounds to heal the healthy. Please stop being silent. How are you? I know you often want to scream in silence when the babies have not did the first brace, when there is no more room for the fear to hide from, when you want to breathe freely, but each time you find yourself suffocating. Please don't let yourself be broken. Please talk to me. How are you? When you're beloved to stand at home, and at the moment they might not be there, when the human conscientious is locked behind the bars, and when they can asunder in the soul and in this familiar streets and the outside, when you've forgotten how it was to sleep peaceful, when the music still can truly save through the merry tunes has almost hushed. Turn it on, join up, don't hide it. Let something good sound too. Listen, don't be silent. How are you? We're already facing this with dignity, gathering all the strengths within. We will strive to survive, and so that means defeating evil. And enduring this, we will only be successful together, not alone. Please don't go through this all alone. Tell me, how are you? As we are thinking clearly today, in just a minute, there might be fewer of us any second. This is why we must live on. We must speak out now. And since there is time, which once rushed, we now move so slowly. For without one each other, there is nothing to be done. Tell me. I want to hear you out so badly. Tell me, how are you? So we are at the point of our marathon that is right now cannot be foreseen really, and the things that we can try to deal with unpredictability is one of the hardest challenges for our psyche. But we know the formula for Ukrainian resilience: unbreakable values. When you know what you are living and fighting for, and who you're with, social connections, and warm relationships that you need to endure and you need to build. The key things were mentioned by the First Lady: to restore a person. A person will restore everything else. Thank you so much, and I wish you all fruitful day today and a fruitful 2 more days in the future. Thank you so much, Oksana. Thank you. And of course, all of those things for you, because this is, for me, one of the best communication throughout the country as of now. Thank you so much. And as of now, we know how. We are practicing this, and as it was mentioned, that this is why if it's all go for a while, but everybody will be mentioning right now about the international or global experience or global and European framework informing mental health services and systems of the future. Key ingredients of success. We will get to know that from our wonderful speakers, so let us welcome them. I'm welcoming Deborah Castel, Director, Department of Mental Health and Substance Use from WHO headquarters in Geneva, and Lydia Lazari, Regional Advisor, Mental Health Flagship and WHO Regional Office for Europe. Please, and welcoming you to the stage.
Hello. Wow. I don't know where to start from, except that I have a presentation, but before I have to say that I feel really honored to have the privilege of being here with you today. It is amazing, and the emotions are very high, so I apologize in advance. I feel I don't have the right to be emotional with all what you are going through, and so on behalf, perhaps, of the area I represent, that is the mental health globally, thank you. Thank you for what you are doing and for bringing this topic so high in the agenda. I have a presentation, luckily, so I don't need to speak from my heart, but just from what we know from the World Health Organization perspective. And following some conversations with the team here, and thank you very much to my colleagues here in the country office, in the WHO country office, and all our partners for helping also with our own preparation. But then I brought some slides that I want to show with you. I don't know if I need to, oh yes, thank you. Thank you. And as many others, I have some notes, but sometimes it's hard to find them, so I can go on hoping I won't forget anything relevant that I wanted to say. So I want to focus on, do you mind if I stand up? So I can move freely. I want to focus on the need to restructure services so that we are sure that all needs of the population at any time are covered. And that's what I will focus on. And this is based on a World Mental Health report that we launched last year, and that it is already translated into Ukrainian. I'm not sure if it's already printed and available, but if it is not, it's on its way. I see Alisa nodding, so it's already there. Thank you, Alisa, for following up also on that. So you can see and read more of these in the book that hopefully will be useful. But we thought it will be useful as well in this context to highlight a few principles, a few key messages we wanted to bring. So you have in this slide, and I will go through some of these for those of you who don't speak English or don't read English, that we want to emphasize some of the issues that were said already in a way that mental health is important everywhere, for everyone, no matter who you are, where you are, what are you going through. Mental health is part of who you are. And I think that is a key message that we are not, for the time being, probably for the years to come, we will never stop repeating, because it's still not that clear. And hopefully with the campaign and the efforts that the country here is going through will become clearer for everybody, at least in this country and from here around globally. The concept that mental health is part of the well-being, of the general well-being, that we cannot be who we are without mental health is also something that we clearly explained in this report, and that everyone has the right to mental health, again, no matter where they are or who they are or what they are going through. I will go later a bit through the idea of mental health on a continuum, but now just to reiterate perhaps that mental health is also relevant to different sectors and stakeholders. It is not, I would say, it is too important to be under the responsibility exclusively of mental health professionals or of the health sector. It has to be involving other sectors, as we saw also happening here. And therefore, through our mental health is that we can connect, we can function, we can be who we are, we can cope with the challenges we have, and we can thrive, as we heard also earlier with the young colleague that talked, the lady that talked to us earlier. And just to spend a few more seconds perhaps on the idea of mental health as a continuum that means similarly to any physical health condition that we could have, having a condition does not define us, and it doesn't tell anything about whether we do have mental health or not. So there are different stadiums or different stages or different situations that we could have that we can go through, and our health and mental well-being will be affected more or less accordingly. We can have a stamp diagnosed mental health condition and still have good mental well-being. But of course, having some of those conditions could affect us to be less well, and we need support in order to get there, to be, again, back on our capacity to have the highest level of mental well-being. And you can read in the report some examples and statements that are, I think, very powerful of people going through having some diagnosed conditions and treatments, etc., and still considering themselves as having the highest mental well-being possible. So I think that's important for us to understand what it is mental health. It goes from being well to being sad, having a condition, and also being with a number of challenges and and facing disabilities that the environment are also presenting to us. So all of that is what we are trying to cover. In terms of the determinants of mental health, how do we get there? We have a continuous exchange and interplay between the individual, the family, and the community, and the conditions we are in, and the society we live in. And that will generate a number of protective factors that will help us having a better mental health, as well as the risk factors, the factors that will be challenging that well-being and could generate a number of difficulties over time. And we heard many of those mental health conditions that developed earlier in time, and that's when some of the risk factors are more clear at home, at school, in the community, in the society. But then bigger factors such as poverty or any other adversity that we can encounter in life, and definitely some of the public health emergencies, and needless to say in this context, conflict and then the consequences of conflict are also very, very extremely relevant and will have an impact in our mental health. But let's focus, this was the introduction, so let's focus now in what do we mean about community-based care in the context of mental health. And we are talking about mental health care that is not including in our definitions and in our understanding the psychiatric hospitals. We are talking about mental health care that is community-based and that is broadly defined, as we will see, and we have a number of advantages, and nothing of this is new. What you have there in terms of those advantages have been stated by the World Health Organization, I think the first time in 2008, if I'm not wrong now, with some work that we did with colleagues working at primary care level and saying how this will be relevant to implement massively to make sure that we increase accessibility so that you don't need to go to that place far away located where people enter and you don't know when they go out, such as the psychiatric hospitals, but we have care here nearby in the next health facility, in school, in a workplace, and you can find there the answers that you need. And that will, of course, have an impact in reducing stigma, in protecting and promoting also human rights, and the outcomes. There is enough scientific evidence proving that the outcomes are much better when care is provided at the community level. So what we propose in this report, and I really invite you to read it, it's written in a way that is easy reading, is not a too sophisticated lexicon used. We propose this network of services to define community-based mental health care. And that means a network of services that is based in the community where the informal community care is crucial, but that involves different networks. It involves, of course, the health sector, and we will look at it a bit more in detail later because that's what we do. We work with the health sector mostly, but it also involves other sectors outside of health, and then it involves also other sectors in health outside of mental health. So these are the three main areas that we think need to be developed in order to establish a working system. And here you have a lot of circles, we call it the bubbles, and here the idea is that this is a model of a network, and each country should be, or each locality, each local community should be able to say, okay, these are the priorities for me, so I'm starting here. I will start developing something, mental health in the workplace, and then I will develop the mental health community, mental health teams, and then I will develop some self-help tools, and then I will make sure that primary care is strengthened. And then from there, I will expand, I will grow up. So that is the idea of this. We, personally, or my team, we don't know any country that has it all. But this is what we encountered in different contexts in the world, and this is what we think is the way to go. Growing from there according to the priorities, the capacity, the knowledge, the expertise in each context and at country level. The considerations that you have there is, of course, what I was saying, the human resources, the possibility of access, and the informal support as well that is needed, that should be in the back, as you saw in the previous slide, right? The community support and the role it plays. Oh, sorry, and what I wanted to say here is that, is that you can see in the health sector bubble, in the pinky area, you have mental health in general health care, which means the role of mental health in general hospitals, the mental health included in primary care, mental health comorbidities, a person with any physical condition could also be listened to and treated if needed for their mental health condition if there is a comorbidity. We are talking about HIV, we are talking about cancer, diabetes, we are talking about a broken leg, we are talking about, right now you have the need to deal with the challenges together, right? If this is physical rehabilitation will also have an impact in the mental health of the person, and that needs to be dealt with, approached together if we want better outcomes for the person and the context. And then we have outside of the health sector, the workplace, I said, schools, prisons, social service, child protection, etc. What is the role of mental health in each one of those? And then in the mental health specific sector, you have the mental health centers and teams. You have programs for psychosocial rehabilitation, for vocation, the peer support services that are more and more being developed, living supporting facilities, and etc. Just to name some of them. But in order to have this system working, as it was mentioned earlier, I think it was the data from Ukraine from some time ago that 80% of the budget, of the health budget, was going to psychiatric hospitals. So we need to slowly change that. We need to make sure that the human resources, the knowledge, the expertise of people working in those institutions for many years, and the people living in those institutions, and the communities where those institutions are located, slowly transform themselves as well into community-based services. And so there is a parallel in deinstitutionalized and scaling up care. It's hard to, only rich countries tried to create a parallel system with supporting the institutions as they were and creating community-based services. And it didn't work because it cannot, nobody can sustain both systems. So you need to work in parallel and develop services in the community and then slowly transfer and transform what you have in the hospitals. Because that's where the resources and the knowledge also and the expertise is. Then, these are some of the bubbles that we saw before, but they are some of the concrete ways of how do you scale up care? Well, you know, you're doing it, right? You have already been doing it for a number of years. We say, okay, all of this is possible. You have to, no, you can. You could slowly, in parallel, develop self-help practices, and you have here a number of experiences, MHCAP integration or other ways of integrating mental health at primary care level, but also in the general hospitals. So you work to receive people with mental health issues in the hospital, but also to work with all those that are in the hospital for other reasons, as we were saying before, with comorbidity. I apologize, I speak too fast, I think, for the translator. I just realized. Sorry. Will do my best, but don't trust me on that. Then we have the mental health centers and teams. I'm not going to talk about that because you know more than I do about why mental health teams are relevant and what are they doing in the country and what else is needed. Maybe something that you can discuss later on. But those are some of the tasks. It's treatment, it's outreach, it's going to where people are, with each one who needs help is in the community, wherever they are, at home, in the workplace, wherever they are, wherever they are. Then the non-school settings, the peer support. So all of these are strategies, again, that need to be slowly, probably you need a bit of each one of them in place in order to make sure that the system works and that you can do what you are supposed to do when you, meaning any citizen in the country, but particularly those with the responsibility to work, to provide help to others, should be doing in order to do it, to provide that help properly. Probably no time to go into this detail of the mental health center or teams, but again, you know that you will discuss that better over this time ahead that we have today and tomorrow. And the idea behind is that in order to be able to do all of that, we need to focus on task sharing. We have all, those of us who have some more years than others, have been trained that the knowledge is for those specialized professionals that have so many years of training, and only those of us with those many years of training can do something in mental health. And I think that that's wrong. We know that is wrong, that those with so many years of training can and should do those tasks, perform those tasks that others with less training won't be able to do it. But there are many others with different specific levels of training that can play, should play a crucial role in providing mental health care. And that is the system that we need, from the individual taking care of ourselves, as it was mentioned earlier this morning, to the role of each sector, and then up to the level of the highly trained professionals that should provide care for those who need that kind of expertise, but also should support the others in their role with supervision, with coaching, with whatever else is needed. So that's the basis of this structure. And with this, I thank you very much. I give the floor to my dear colleague, Lydia Lazari.
Thank you. Thank you, Deborah. And I also take advantage of standing up because I feel more authentic in communicating with the audience. Now, I'll start by saying something. Deborah Kestel and I have been around for quite some time. I'm not saying this to make you try to guess our age, rather than understand that we have been together in the initiation of mental health reforms in a number of countries, and none of those countries have finished the reform, which is why we are around. It's just to say that a reform is something that has a start, but doesn't have an end, because societies change. Societies might be subjected to wars, to natural catastrophes, to whatever conditions, climate change, a cost of living, a pandemic, which means that mental health services should adapt to the new conditions rather than the other way around. Now, I have been asked to talk about what are the ingredients for a successful mental health reform. And I think Deborah was very articulate in mentioning those ingredients. So please, this presentation is in no way an exhaustive list of ingredients, rather than a contextualization of some of those ingredients into the European context. Because while Deborah is the director of mental health for the global WHO, so she's responsible for all the WHO regions, I am responsible for the mental health program in WHO Europe, which means that I'll share with you a number of European countries that have gone through working with these ingredients. So if we want to make a parallel for a mental health reform as something that is being cooked, but is there a cookbook for success in mental health reforms? And to start with, we need a cooker. We need the cooker that we'll put all the ingredients that will be coming together. Now, before I go through the explanation here, I also want to propose the audience here, especially my dear Ukrainian colleagues, to take this as a test and to try to see if every ingredient that I'll go through resonates with what they are working. And then I'll ask questions at the end of my presentation. So first, the cooker is a policy framework. We cannot start putting ingredients anywhere if we do not have a policy framework. And in this sense, I would like to evoke the great experience that Sweden is having in having mandated 26 government agencies to work together for 3 years in developing a common vision and objectives for a mental health strategy. Now, if any of you is questioning the reason I put Sweden here, I would like to argue that it is very important to invest in the process of policy making as much as it is important to invest in the outcomes of the policy. And this is where Sweden not only is capturing the importance of the timing that policy making takes, but also the importance of intersectoral collaboration and coordination. And the picture here shows the Minister of Health of Sweden and the team from his ministry visiting the Regional Office for Europe and meeting a WHO team only a month ago. Now, the second ingredient that I'd like to highlight here is the people. And when we talk with the people, of course, we mean everybody in the community, general public, certainly mental health professionals, but first and foremost, I would like to highlight here the people with lived experience. So those who are at the other end of the efforts for delivering mental health care. But we have a paradigm shift here, because we are no longer looking at people with lived experience as people at the receiving end. So we provide, they receive. We try to see people with lived experience as part of the mental health professional teams. They have exclusive knowledge about their mental health condition, and therefore they can no longer be only recipients of care, but they should be co-creators of the care intended for them. And in here, I'd like to highlight a wonderful initiative by Denmark that has established One of Us. This is an initiative that is a page and taken on board at the Danish Health Authority level, composed of volunteers who are people with lived experience, lived mental health experience, who undergo training and who therefore go around to try to address stigma and discrimination, to try to educate health professionals, not only mental health, but health professionals in general, etc. And the picture here shows an activity we held around the 10th of October Mental Health Day in WHO Europe, where the person in the far right is one of the ambassadors. Rune is someone that has gone through a very serious mental health condition and who is now a volunteer that goes to emergency rooms in Denmark and talks to doctors there about the importance of trying to see every emergency patient with a mental health lens, because people at the emergency rooms might be panicked, might undergo a number of comorbidities, and Rune is there to also educate the emergency room staff. Now, my third ingredient here is the skills. We need to train and build capacity for professionals. We heard a bit from our colleague from the National Mental Health Center. And here I'd like to highlight the experience in Turkey that has embarked upon a national program for implementation of Mental Health Gap, which is a WHO signature tool for scaling up mental health services in non-specialized settings. I know very well what many of you are thinking, because I know that MHGAP is now very popular in Ukraine. But let's leave that thought for the end of my presentation, because I'm going to test you. And this is a picture from one of the trainings that Turkey took. As you see, it was during COVID, on training their health primary care professionals. The fourth is networks. We need to connect. Deborah talked and presented the bubbles scheme. We cannot have mental health services standing alone. We cannot have a community mental health team here, and then an inpatient unit there, and then a supported accommodation somewhere else. We need to have them in one network. And here I'm bringing as a good example the public mental health services in Lille, France, that are all organized under one umbrella, run at the municipal level. So again, focusing on the local government responsibility and accountability. This includes prevention, diagnostics, ambulatory, inpatient and home care for children, adolescents, and adults. And I'm happy to share with you that we are in touch with our colleagues in Lille, that is a WHO collaborating center, to see if they can accommodate a study visit from Ukrainian professionals there. And sorry, I did not focus on the figure here. Is a kind of a graph about how the Lille services are organized. The fifth is the services. The establishing services in the community that was so key to Deborah's presentation. And here I'd like to evoke the Belgian mental health care reform that is based in a comprehensive and integrated approach with the construction of a network around the user. So it means that the person with lived experience doesn't have to run after the services, rather they're the other way around. And in line with needs, and especially with a recovery-oriented vision. So we are not here to entertain our patients, we're here to support them to the path of recovery. The beds, the sixth dimension is the beds. Mental health beds have to be used for therapeutic purposes only and only. We still have thousands, if not tens and hundreds of thousands of beds across the WHO European region where psychiatric beds are used for containment, for no therapeutic purposes, and therefore do not serve any good for the health of the population they are meant to. And this is what do we do with beds? We deinstitutionalize asylums. And here I've brought the case of Albania that has transitioned into supported community living of more than 1/3 of the long-term residents of psychiatric hospitals of the country. And here is the picture of one such supported home in a city where, mind you, the supported home is only one of the services. They have strong community mental health teams and center. They have strong social networks and municipality accountability. The seventh is the rights. Again, Deborah talked about getting appropriate mental health support in the community where a person lives and have their life is a right. And here I'm trying to, I'm bringing the case of Estonia that is training its mental health and social welfare staff. So both Ministry of Health and Ministry of Social Welfare are coming together, and they are training under the WHO signature tool Quality Rights to promote rights and recovery for people living with mental health condition and intellectual disabilities with a long-term ambition to deinstitutionalize their psychiatric hospitals. And here it's a picture from Estonia where our team was there to deliver the training on quality rights. The seventh and the last is in my list, but not the last in the big list, is knowledge transfer. You see on the top right there, I have the logo of the Pan-European Mental Health Coalition that WHO Europe has established as a platform for knowledge transfer, for people meeting other people and learning from each other's, not only successes, but also failures. Because what is very important is to learn what does not work. Deborah mentioned a bit, for instance, it doesn't work to have two parallel systems. It's a waste of resources and it's not effective. So we need to know about that. And Trieste in Italy is another example I'm bringing, is a center of excellence representing the best of the Italian mental health reform and serving in the last decades. And it's a laboratory for the transfer of knowledge through exchange visits from all over the world. The picture here is from yesterday. We are having a delegation of ministries of health from the 5 Central Asian republics that are now, as we speak, in Trieste, trying to learn from the Trieste mental health services. And I'm happy also to announce here that an agreement has been made with our WHO Collaborating Center in Trieste for a study visit of Ukrainian professionals there in Italy. Now, before I go to my last slide, I want to ask the audience here, how many of you feel related to all the ingredients that I shared with you? Can I have a show of hands if you feel? I thought so, exactly. Because what I want to make very clear is that with what is happening in Ukraine, the Ukrainian mental health professionals are part of this big European and global family of mental health reformers that are trying to make things better for their populations. And you see, you have the cooker there. You have the operational plan that was developed under the First Lady's leadership. And then you have those wonderful community mental health teams that are not only new, one of those pictures is from years ago, because, as I mentioned from the beginning, mental health reforms have a start date, they do not have an end date. So with that, I want to very warmly highlight for all of us that the audience here is part of this global mental health community of like-minded reformers, and I can only look forward, together with the country office here, together our headquarters, and together with our other international partners that are in this room, to bring this forward. Thank you.
So thank you so much, Devora Lady. I thank you for sharing your experience and knowledge. It's priceless. Thank you so much. Дякуємо дуже. Давайте ще раз поаплодуємо.
Thank you very much. Let's put our hands together for our speakers.
Ну і тепер від глобального знову
And
повертаємося
from
до
the global
і зараз ми
to
з вами
the domestic.
почути більш детально про дійсно
And in a minute, we will be exposed to a great case. This is something that is already in the making. This is a case of integration of mental health services into primary health care in Ukraine. And give a rapturous round of applause to Ms. Irina Mikitchak, Director for Coordination of Central and Executive Authorities, Coordination Center for Mental Health Advisor to the Prime Minister of Ukraine, and also Ms. Natalia Husak, Head of the National Health Service of Ukraine. Welcome, our ladies. The floor is yours. Thank you, Timur. Thank you, colleagues. I would like to extend my particular gratitude to Oksana, Deborah, and Ladia. Thank you very much for this neat and high-level introduction to the topic that is the centerpiece of our efforts, of our endeavors. This is something that we invest all our energy and inspiration in because we understand the importance of mental health for our country. I would like to take you closer to primary health care. I would like to take you closer to persons, to services, and I would like to have a discussion as well. I know that in the audience we have a lot of general practitioners, family doctors, primary health care professionals, and I know that these are the people who are implementing new knowledge and new services in our society. A lot of us do not really intend to approach a family doctor when we are feeling under the weather. Like, for example, when we are gripped by fear, or maybe there is tremor, or we are overflowing with anxiety or suffering from the loss of appetite. We always say to ourselves, what for? We can help ourselves. We don't have time for it. We have to rescue the entire world. Or it's not really the right time to think about ourselves. But do we ever think whether it's better to approach a family doctor if we are suffering from anxiety or some fears? I think that this thought doesn't really cross the mind of most people, but there's a panoply of arguments testifying to the fact that mental health services and psychosocial support services must be accessible and integrated in primary health care or general practice. I can talk extensively about each and every of the arguments referenced, and I have faith in the fact that you will concur with me and that you will be able to put even more arguments on the table. But we definitely have to combat barriers and stigma. We have to give an opportunity to each and every person to receive the much-needed care as close as possible with the highest quality possible. And it has to take place in the setting of that person. It has to take place in the presence of family members and dear ones, because if such services are provided in such a setting, then the treatment will be more effective, social bonds will not be severed. This treatment will be comprehensive, integrated, multidisciplinary. This will definitely contribute to the reduction of stigma, and this way we will be able to ensure human rights and the dignity of people, which unfortunately is still lacking in our specialized institutions and hospitals. And there's this prevalent thought that specialist care, psychiatric care, is something extremely complex and has to be offered only in isolated institutions. But in fact, GPs, family doctors, and primary health care professionals can successfully grapple with these tasks. In 2008, we launched the MHGAP program. This is the flagship program of WHO. It's all about mental health gap action. This program is being implemented in upwards of 100 countries globally. The materials of this program have been translated into multiple languages, including Ukrainian. And this program and the trainings within the program help us inch closer towards mental health services in primary health care. And it's not only about doctors, it's about GPs and family doctors in the first place. We are profusely grateful to the WHO team because they basically grabbed the Ukrainian professionals by the hand. They conducted initial trainings, they inspired us, and we embarked on this journey of MHGAP mental health program. In these photographs, you can see our colleagues who conducted their first trainings in 2019. Fami is present here, Igor Zastavny, Ores Suvalo, and some other ones. These are the people who were the driving forces behind the implementation of the mental health program in Ukraine. And I'm very grateful to this team of people because I remember that on a high-speed train, they shared with me what MHGAP was, that we should not be afraid of them, that we need to join the forces of medical professionals, society, and other stakeholders to lend a helping hand to everyone. The 24th of February 2022, at that point in time, the hybrid war had been raging for 8 years, and after the 24th of February 2022, we took the brunt of the aggression and terror on the part of our neighbor. We faced some new challenges, and there was an ever-growing need to build and scale up our capacities. these challenges are also about new opportunities. This is a great opportunity to transform and change something that we haven't been able to reform for years and years. The transformation of the mental health center in Ukraine was a work in progress, but it was very difficult to achieve some shifts after the outbreak of the war. And the focus of my presentation will be on the integration of mental health services in primary health care. The head of our coordination center has already alluded to the Interagency Coordination Council, and this body adopted top priority mental health projects. One of them is the MHPSS integration in primary health care. So basically, the ultimate purpose is to integrate mental health services in healthcare in general, in particular in primary healthcare. The team of the Ministry of Health of Ukraine that I was part and parcel of at that time set a number of objectives in front of ourselves. We have a very good understanding of the fact that you cannot transform the system overnight by dint of one regulation or order. So the objectives are listed on the slide. They include the elaboration of training programs and curricula, the training of the team of trainers. There's another important aspect that has already been referenced several times today, the political will of health policy creators and implementers. It was very important to make appropriate managerial decisions that would provide access to materials, to resources, to training, because back then it was even challenging to delegate relevant professionals to trainings. It's an onerous task to inspire the top management of the relevant institutions, but we are already succeeding step by step, gradually but surely. We are changing the morale. We can see a lot of administrators and managers who are actively engaged in mental health services in primary health care. So we are already on this pathway of creating mental health into a holistic and integrated program. In November 2022, we concluded an MOU with the WHO and the Ministry of Health of Ukraine. You can see the stark difference between the trends before the 24th of February 2022 and now. Back then, we had only about 1,000 professionals trained within the specialized MHK program. If we have a look at the stats nowadays, we have about 4,000 trained professionals. So basically, an additional 3,000 trained professionals since the beginning of 2023. There's an immense need for trainings, and considering the presence of WHO colleagues here, we would like to reiterate that such trainings are crucial for us. I am extensively grateful to all the partners who have contributed to the training of our medical professionals.
We do have even the leaders and our partners, and also the USAID project on the development of the sustainable public health system that was implemented by PACT project, which is the team MH4U and Ukrainian Swiss project of mental health for Ukraine, and the team of health rights, the UNICEF team, which are the teams that are moving in front but not dedicating or decreasing the value of any other partners for the family medicine, Prolisac, and other teams, and many, many other partners. I will also ask for us to have this training on, and so we moved forward and prepared a video, and we've decided that just one offline training is not enough, and this is why we are so grateful to the partner teams that helped us to establish and implement the initiative, the Ministries of Health of Ukraine, and to create an accessible an online course for the teaching of our medics, and not only medics, on the MHGAP program.
MHGAP.
MHGAP, the Program of Actions for Countering the Gaps in the Mental Health System. MHGAP initiative in Ukraine. 20 partners have joined to the implementation. Over 4,000 medical employees have passed this education. Over 45,000 people finished online course on the NHSU Academy. In Memorandum of Understanding on the implementation of MHGAP program in Ukraine in November 2022. Implementation of the project of MHGAP program of the WHO, the results of work on the partners, Project Hope. On the training developed for the MHGAP program, we are teaching family doctors and family nurses to work with the patients that have signs of mental and neurological disorders connected with the psychoactive and active stress. International Medical Corps builds the potential doctors and psychologists, conducts trainings for trainers, and conducting the trainings for medical employees of those villages and places where there's a high need for mental health services or insufficient number of resources. A communication platform for MHGAP established, so what's written on the slide. We are working with the MHGAP projects and the mental health for Ukraine. From 2020, we've taught more than 2,000 medics in the western parts of Ukraine. After the full-scale invasion of Russian Federation, our work was hardly possible, but we have consolidated resources and continue to do because mental health of Ukrainians has become as a higher priority as ever. We are working in shelters. We are helping to work with this process with the consequences of prolonged stress influence. Ukrainian Swiss project Mental Health for Ukraine from 2020 has conducted trainings on the MHGAP program. We are conducting training with our partnership organization and our pilot regions, Donetsk, Luhansk, and also Lviv Oblast. After the full-scale invasion, we are conducting also in Rivne, Kiev, Dnipro, and other oblasts. This is the National Health Service of Ukraine online course for MHGAP. Unfortunately, we don't have the team as Switzerland has mental health. There's 7 people in coordination center, but we have things to strive for, and we are helpful and hopeful with the support of our partners we can get this team in Ukraine. But we have really stable and valuable partners, which is every doctor, every nurse, which is the ginormous number of people who are included in the education and services integration. And we have National Service of Ukraine, National Health Service of Ukraine, that's taking the unspecific function that for them, and they taking inside of the integration of everything. Wonderful. We started this online course in December 2022, and so this was also against many odds, and in an online way, we have seen how many colleagues registered there because this was so important and so interesting and so inspiring. What is happening right now? So, if we are to mention about the program in general, I'd just like to add a few words from myself that I think that Ukraine did not have such a working strategy as that we have on the mental health strategy. And so I think and I saw how the state first person that the strategy, not just the people who are working in this, but under which many people are working that understand that they are doing something for the people. When we are speaking about the primary care, we looked at the many issues and that we have to build our own system, our own support systems for the people that have issues, for example, for mental health issues. And so we've named it in the both accessibility and trust. But for me personally, this is about not being indifferent because the army of after passing COVID-19, after vaccination, I knew that all of those people, just one word unites them. This is the being compassionate to others. And when we saw how many people have been actually trained and educated and offline and online courses, how many people have been given for the online courses, and that this story really silences the fact that this package has been launched in 2022 and then not that many people were able to get contracted with national, but also the ones who came from the offline courses, they have applied and they have been contracted and they've shown the example to their colleagues that this is important for Ukrainians, and the colleagues have supported. And so now we have 53 and 90, and so a lot of people, those not just doctors, this not just medical employees, as the story shows, that those are the people from non-medical education that also are interested whether how they can be useful for a time for those people that are located nearby and require this kind of care and support. And what's also important that this number of people that are getting and finish this course, National Health Service of Ukraine, as a national NHSU academy, also didn't have. So right now we see 46,000 people who finish this course and receive this certificate. And we also see that how the history and everything shows how it happened daily and monthly, the dynamic of the receival of those courses and receival of the certificates, that more and more people are joining us, the people who are ready to go for the MH-GAP course. On this slide, you can see how needed this is right now for different regions of Ukraine. And even though this is just the quantitative and not qualitative indicators, we've looked at many qualitative indicators at other meetings that we have so that we can have a critical approach to the work that we do. But the quantitative indicators are showing that this line of care and support, this line of training is accessible to all of the regions in Ukraine. And this is an inspiring thing to have, since for the second year in a row we have specifics and on receivable the care in different parts of the Ukraine. And I also like to mention that we have learned together to administer this process. First of all, by the passing this MHGAP course, as you know, we have as the requirement on the pre-contracting for this package. But together with that, and this will be continuing to do, was the wonderful experience, and we are ready to move this experience further for other packages, and this helps us be in line. And together with that, after we did not have like more specific roles during the registration, and you know that we tried to improve the processes, and now we can name more specifically the number on which number of what kind of specialties people were in that registered to the course. If you're mentioning about the certificates that were received, the quantitative indicators that I'm saying here in Cherkasy Oblast, for example, medical and non-medical employees that received certificates on the course the most, and even though when we are to mention about the effectiveness indicators and result indicators, then here the Cherkasy Oblast needs to review before that and to believe in their efforts, especially for the doctors, because the courses were actively passed, but not in a full amount are believing in our own efforts and capacity on the mental health services provision. But in the same way, this slide actually shows that compassionate medical employees from every part of Ukraine, from every region of Ukraine, they are continuing to do so. During this year, they've become and they found the time to motivate themselves, to motivate their colleagues, and to pass for this important course for them. And also, there was a slide on the certificates. So together jointly with the WHO, with Alisa Ladek-Razhalova, we worked on such a unified electronic certificate that the colleagues are getting, which is important that this is the integral part of the system of the continuous professional education of the Ministry of Health of Ukraine. And so recently, a few days ago or a few weeks ago, there has been a decree of Cabinet Ministers of Ukraine that has implemented the electronic program of the continuous professional education, which is highly important so that the colleagues can get this certificate, that it's in the register with a reference number. And regarding the effectiveness and efficiency, by analyzing the passing of this course and trainings of MHGAP, you can see how significantly the level of the knowledge grows of our colleagues and the level of significance in the services provision and mental health on the primary care. And also, such a serious thing that we think has happened. This is what we implementing supervisions and support for that, because it allows to improve the knowledge, to do the monitoring of quality of care, to support the colleagues. And so here it's important for us as well to have the role and input of the World Bank team that's working with the Ministry of Health of Ukraine, with our team, in the implementation of this new project of the World Bank in Ukraine, where there's a separate component connected with mental health. There is a plan on implementation of the supervision, and so that in the nearest future, the colleagues wait for that, and so that this kind of support will be provided. And this is so important for the future support, that we have all the information that is connected with the trainings and everything else, and the certificate is on this QR code. It's so important, it's needed, it's useful, and it's accessible. And I would also like to get back to the fact why the primary medical care, because the reform of our healthcare system in Ukraine is still ongoing, and it's been going for 5 years, and we see good results for that, the transformation of primary medical care or primary healthcare system altogether. And right now, this is the biggest of trust to the people and the biggest access, which is the accessibility, which is the perspective for the future. This is why it's so important for primary care to be motivated, and for the primary care, they have a comprehensive line of care provided, and on the mental health and everything else, and mental health support and everything else. There was a joint decision made, and supporting this initiative of the First Lady of the President, and there has been a decree done, and in the context of all this problem with programs, a program for medical guarantees, and there's also support for adults and children, which is the portion of this state of state guarantees, which is not one-year project. This is a perspective for all of us, for people to get quality-based, good support and well enough medical care and mental health. And to cover up for the mental health support that's training, right now we are preparing the requirements to the package for the next year. And as I promised before, we are increasing the passing points and the percentage of the doctors trained. And if we are mentioning about the doctors, which is 70%, and nurses, this is going to be 30%, so that, dear partners, we are welcoming you who have not yet passed this course. It's accessible on any levels that we have mentioned right now. And what else important in the training that we have to mention here, that yesterday, because of the partners, on the NHSU Academy, we have placed the second portion of the MHGAP program, and every Tuesday there's going to be an update. This is why welcoming you all together to pass this course, to improve your knowledge. And what's personally important for me about this, to mention about this training, we can speak on different levels, that everything is working before you yourself. We're not going to go into the ambulatory in the village and will not ask like a doctor, does this training help them? From what I see, from what I hear, that in reality the course is working and helping a lot for the ones who want to include this in their practice, which is that learn how to talk with themselves, with the partners that are coming, with the patients that are coming, with their pain and their hearts. If mentioning about the mental health support regarding within the program for medical grantees as a strategic procurer, we've always tried to take care of the fact that so that the support and care for health of the population would be integrated to care for both physical and mental health portion. And therefore, in many packages, a program for medical guarantees, the mental health support is included and it's fully integrated. But it was mentioned by Irina, in 2022, we tried to procure unique services for our country, and specifically supervision and support for the patients that require mental health support on the primary care level. Yet again, we do see that this service creates like a unique experience of Ukraine in this area. So as of now, this is 705 facilities that have been contracted with National Health Service of Ukraine. And I also like to point your attention that this service is accessible and for Ukraine, both for Ukrainians who live in Donetsk and for Ukrainians that live in Kherson Oblast, because of our partners, because of our primary medical services to private primary care providers, where we are procuring those services. And so also a big line of gratitude for the leadership of our partners that taking care of the services, not just contracted, and the service is not just received, and they are taking care of the accessibility of the services and the provision of such services. There's so much many more than this 700 facilities. And if we are to mention, and as I mentioned before, we first of all try to contract based on the requirements of the additional knowledge required, and also so grateful to other partners that we were able to implement this all together in a good way, because if we would not have the access to the medical employees, would not have the access to this knowledge, we would not be able to procure this kind of service from them. But National Health Service of Ukraine, even in this, was a principle, because there has been a lot of discussion that, well, maybe we need to decrease the level, maybe there's less number of hours on the course, but we did see that this principle, this decree that we have, that gives results, it delivered. And so if we are to mention about the responsibilities, and together with the experts, and those are the experts from the WHO, from the Ministry of Health of Ukraine, then we have specifically mentioned what kind of services to be provided, and we did understand that this amount of services to be provided is really intertwined with the MHGAP program, so this is understandable for the medical employees as well, and that it will be understandable both for the patient as well, especially to the ones who trust their doctors, and the ones that have a full access to their family doctors. And what do we see in such a timeline? That right now the 50,000 patients already received the support from their family doctor, pediatrician, or internal medicine doctor. And every month, the number of people that are giving this service, number of people who are receiving this service, their number is growing. And based on those numbers, there's living numbers with their pains. Is like in Chernihiv Oblast, when I was told by the family doctor that our military personnel got from the being captive, and so you needed to know how to speak with them and to provide care to them, to him, to his mother, and to the military personnel themselves, or as an internally displaced person, or the person has to look for safety and move to the unknown place, and also got into the family doctor first and foremost and mentioned honestly about the depression, fears, the fact that they cannot fall asleep during a big period of time. So we do see that 58,000, those are living human beings that need help and support. Here, I'd just like to reach out to our family doctors and also we've seen in these numbers who require this kind of care. Just believe that you can provide this kind of support. Believe that you can show, and it's mentioned that we just wear this mask on yourself when we need to take care of somebody. I think that here what's needed is to more so believe into your own efforts and discuss between one another. And I think that this can help you personally to integrate this service even more into your communities, into your villages and your places of residence and work. Speaking about the regions, like how does this 58,000 people looks like, how they receive these services in the framework of regional development or regional separation. The general number, we are not focusing on the quality indicators, but just the quantity. This is both Dnipro, this is both Lviv, this is Poltava, this is other parts. Together with all that, we do see that people are still having this access to this service, which is important for us as the services procure, and both in Donetsk Oblast and in Kherson as well. Together with that, everything I mentioned, it more so we need to have the beliefs in Cherkasy for their efforts, Kirovohrad as well, into their efforts and capacity, because people are waiting for this kind of help and support. And what kind of diagnoses the people reached out to family doctors to receive care from them. And you can see here that there is anxiety, there is a sleep disruption, and so there is also psychological and mental health issues that they've been with. And there's also anxiety, anger management issues, and beforehand we can be supported by the psychiatrist and psychotherapist. Beforehand, for some reason it was thought that this was only the pathway to specialized care and everything else. And so I'm so grateful yet again to the primary healthcare doctors that you are breaking those stereotypes. And yourself, what I saw, that this constant stress in the primary and specialist care, it's sort of been destroyed in this medical service. And this is mentioning but the fact that you are ready to start and you're ready to do so. Yes, we are paying for this service, but as the person who is paying timely and represent this organization that pays for the contract, I can say proudly that the funds were not the moving portion so that you would participate in this program. And this is everybody can also support that. But together with that, almost 8 million hryvnia, so budget funds, National Health Service of Ukraine has paid for this service. And yes, we do remember that there are many aspects, many issues that you have to still process, because we are just at the beginning of this prolonged journey and a complex journey, and constantly are trying to bring ourselves forward by speaking with family doctor. The Coordination Center for Mental Health of Cabinet Ministers of Ukraine has implemented such a practice to conduct discussion clubs. Let's speak about mental health. This is what we named for ourselves, and here family doctors for us are valid partners in this discussion, just as the heads of the Department of Family Medicine, of Psychiatry, and so the constant dialogue with the professional community gives us a strong support so that we can move forward. And so the work on the strategy, there's like simple matters, but they are important. And if there is in front of us the international partners that have not yet joined to the scaling up of this integration of service on the primary care, we are welcoming you, because the environment, the professional environment that is being implemented by this service, this is motivated. Those are the people, those are the doctors, those are the nurses, social employees, psychologists, psychiatrists that are really changing the world in Ukraine. They are changing our mental world, and they are helping us to grow at the times when Ukraine is at the state of war. There is a process for a roadmap of the further integration of services in MHPSS, And here I'd just like to point your attention to the fact that the integrating services and the primary care, we are also moving by the deinstitutionalization of the mental health support, and the National Health Service of Ukraine, Ministry of Health of Ukraine, together with the organization center that has given their shoulder both to the Ministry of Health, that is the leader in this area of work. And so we are working on the new packages, on the new proposals, on new services, on the integration of the services in mental health, specifically and actively to the inclusion of the community, because this is the basic things. And so when you know that you have issues, when you know that you need to reach out to family doctor, and we can be proud of family doctor that have become the leaders in this services implementation. And so working in mental health, we know well that the motivation is the key. Motivation inspires people to change for the better. Right now, we are inviting to this podium our colleagues, our family doctors that are present right now in the hall. Alina Odensova, the head of the Center for Primary Medical Care, number 9 of Dnipro City. And so where are the gifts? Okay, because the partners slept through that. Okay. Okay, let's just invite everybody to this podium. Okay, we can build up here, and so that we did not lose anybody. Helena Odensova, and asking for you, Svetlana Tikhonenko, Андрій Подольний,
Зараз в нас тут не по порядку. Так, Андрій Подольний.
Okay, Андрій Подольний, are you here? Okay.
Так, Світлана Тихоненко,
Світлана Тихоненко, Маріна Терзі, Оксана Каліниченко,
Олена Колоденко.
Олена Колоденко.
Колеги, ви всі є.
Colleagues, you all are. Where do we have?
Іванна Солдан.
Іванна Солдан.
Ой, Марина Терсик. А, там, прошу. Прошу. Так. Оксана Колоденко, Янченко. Так. Наталя Тарасова.
Наталя Тарасова. Олена Колоденко.
Сергій Литвиненко.
Сергій Литвиненко.
Наталя Тарасова.
Наталя Тарасова.
Віра Шаповал.
Віра Шаповал.
Так, шановні колеги.
Dear colleagues,
Це я так вручила від
I am giving this from the Ministry of Health. On behalf of the Ministry of Health, I remember just that Victor mentioned that since the government right now is taking place, and so with the support of our colleagues, the WHO, the Centers for Primary Care, that have provided the most services in the mental health, based on the new package, those are the leadership, and for their professional development, they receive the gadgets, the tablets. Please work, please be inspired, and the gifts will be even better, and Ukraine will be even stronger. Please receive your diplomas and everything else. Please take your... Who is the Shapoval? Okay, the round of applause to our colleagues. Please smile and please enjoy. Okay, we are not stopping with the applause that we have here. Thank you so much. Thank you, thank you. Thank you so much, and joining to the welcoming words, Natalia and everybody else, thank you for your presentation. Before we will move to the lunch break, there's just 1 minute of organizational issues. The first and probably last thing. So right now we are moving into tomorrow, and I'm sure that you all know that we will be waiting for and expecting for many workshops and many sessions. And so it's so important to register for them because there is a limited number of places. I would just like to place the QR codes for tomorrow that you can scan. And let me move past a bit. You can scan and note down for the registration for any kind of workshops that you would want to have, that you would be interested, that you would want to have to visit, because the number of places for all the workshops are restricted. Maybe not right now. Now you can scan it, and so then you can, with the coffee or something else, you can register. But let's not lose the important moment. This is why please register and be active. Another big request for the people who were not able to register altogether for the forum was altogether in the morning, because there has been a big line of people waiting, and so please do register right now, today during the day, so that tomorrow and the day after tomorrow we did not have any issues with the entry. This would not take a lot of time. And also the most important thing, let's agree to, it's 13:45 together here, and at 2 o'clock we will start sharp the next part of the forum. And now the most important thing, to take some rest, to eat some, and so please have a good lunch.
deal, but I can see that whoever is back has smiles planted on their faces. Everyone is cheerful, so your mood is definitely better than in the morning. How are you? This question again, you are answering back, so I do have confidence in the fact that the lunch break was beneficial and supportive for all of you. I really hope that you tried those pastries. Not everyone, well, you should have. They are delicious. If possible, fetch even two. But anyway, let's get back to the working mode. A lot of you approached me and said that the QR codes are not operational. They are functional, but when you have upwards of 300 people trying to join at the same time, the platform gets overloaded. But this is a sign of the fact that we are moving in the right direction. Not everything at a time, not everything at once. So try to scan the QR code if you haven't done so yet. Try to sign up for one of the sessions tomorrow and the day after tomorrow. Yet another reminder that the number of seats is limited. So if you want to make sure that you attend the desired session, do it in advance, sign up, get registered, and there will be another busy and saturated day tomorrow, but that will be tomorrow. Now back to the main stage. Yet another reminder that today all the activities, all the panel discussions and events will be taking place here on the main stage. The agenda tomorrow will be different, but back to the main stage. Ladies and gentlemen, we will hear from the horse's mouth right now, as they say. We will be talking about something really important. I would like to announce a TED Talks format speech, and the topic of this presentation is as follows: what can be realistically done in primary healthcare? Reflections of a family doctor. Or to be more specific, reflections of family doctors. Please start clapping your hands, and I would like to invite up here Mr. Igor Zastavny and Ms. Anastasia Khodin, family doctors, beautiful people, so they're not just family doctors, they are wonderful human beings, but they will tell you more about that. So ladies and gentlemen, co-founders of the NGO Academy of Family Medicine of Ukraine, Igor, Nastya, the entire stage is yours. Greetings, thank you, colleagues, hello everyone. It's a great honor of ours to be speaking here today. My name is Igor Zastavny. I am a board member of the Academy of Family Medicine of Ukraine, co-founder and a family doctor. My name is Anastasia Khodin. I'm also a family doctor and a co-founder of the Academy of Family Medicine of Ukraine. I'm also a board member of this organization and a master trainer within the MHGAP program from WHO. When we have some free time, we also spend some time with our families. I mean, providing that we have some time on our hands. Thank you for that. Well, by the way, no one got interested in the fact that I am a master trainer within the MHGAP program because family is key, right? Anyway, we would like to briefly share some evolutionary stories that unraveled to us. I remember a letter that I received from someone from WHO back in 2019, and I'm very sorry if you are here. So it was an invitation to the first MHGAP training in Ukraine. I worked as a family doctor in one village, and Nastya worked as a family doctor in the adjacent village. Makes sense, right? And what did we think back then? By the way, I'm not really sure whether we are being interpreted into English, but I thought that it was BS because I remember how I was taught psychiatry at university. It was not the best experience of my life. I'm very sorry for that. But anyway, we received this invitation. We went to the training session, and on day 5 of the training, I had no clue what MHGAP was and why we as family doctors needed psychiatry. Now we are conducting MHGAP trainings, and we received this question from our participants: why do we as family doctors need psychiatry? I always answer, I've been there, I've seen that, it's not really psychiatry, so there's no understanding of why it's needed, what the impact is. So we just went to the training, we participated in it, but we didn't really have any inkling whatsoever how to implement it. So in 2019, I was back after that training, and as any family doctor that respects himself post-training, I just stashed the MHGAP textbook somewhere. I didn't really have a clear understanding of why I needed it. I thought that I didn't really need that. Alrighty, I participated in this training. I can just stash this textbook somewhere and I continue with my life. But in life, we often bump against moments that give you a hint that you need to engage in something new, in a sort of new endeavor. And this is something that happened to me in my village. But by the way, all the stories have been modified. Any overlaps with real people are also made up. Well, you understand what I mean. But anyway, about 1 month after the MHGAP training, a young guy passed away. He was aged 22. He died because of a disease. And I had this tradition back then, so if there was a funeral of a young person, I would always attend the funeral because I wanted to be there as a doctor. And maybe there would be a need for emergency care and things like that. And the MHGAP textbook says that you should not really offer any sedatives or things like that. But of course, I had those medications on me as a person who attended the training. So I went to this funeral. It was a very sad experience. In several weeks, the husband of the deceased mother came to me and said, you know what, my wife doesn't want to eat, she doesn't want to drink, she doesn't want to get up, she is wrapped up in her blanket, she doesn't want to talk, she's been crying for several days in a row. So I had to do something about that, and I decided to call Orest Suvolo. I think that Orest is here. Hi there, Orest. Orest is a psychiatrist. He is a reliable friend and advisor. So back then I called Orest and I was like, Orest, you know what, I think she's suffering from depression. And I remember that there was consternation on the other end of the line. Come on, Ihor, you participated in the MHGAP training. It's grieving or bereavement. So I found the textbook. I reread everything about bereavement and grieving. And day in, day out, I would visit this lady and I would spend about 3 to 4 hours next to her side. I was just there by her side. There were some legal nuances and aspects about the story as well. The children of this guy who deceased could not really see their grandparents because the mom was against it. So basically, we followed all the steps, everything in line with the textbook. So I had to reread the MHGAP textbook again. And then after some time, she stuck her head out from under the blanket. She started drinking tea with sugar. Then after some time, she started eating again. After some more time, she stuck out more body parts from under the blanket. And then finally, she approached the psychologist that I referred her to. And later, she was able to attend to all the legal nuances and aspects as well when she recovered and restored her mental fortitude and inner power. This example is a great testament to the fact that it takes us some time to understand the importance of mental health.
Then we understood the instrument and we started to use it in the next story that we have. For example, it was in a year and a half ago, I guess, when we had started to roll in and do the basics and knew the methodology of that all. And so I have admitted a patient, like a young lady, was a 6-month-old baby. She had somatic issues that we were trying to solve. But together with that, she can't really look for this baby anymore. She has no effort, she has no power, she has no inner resource. And so she even thinks to finish the breastfeeding because she just doesn't want to feed the baby with that. She just doesn't want to have it. By having this information, I knew that this was depression. We did the questioning on the depression. She had a high level. She didn't want to reach out to any specialist. She said, I don't want to go anywhere. Don't tell anybody. Maybe I can lose the trust for this person, and also that she has thoughts to so that there is no, like, any threats before. She feels like the big responsibility that she has to take care for the baby. And I can only imagine to be afraid in your place, not to want to live, but force yourself to live. She doesn't want to take any medication. And the points were really high in the depression scale, and by consulting with his orist, and he said that this is a complex case. This has to be a psychiatrist working with her, but she doesn't want to, and so this is why I said that I'll either reach out to the psychiatrist, and nobody knows how it was going to end, and either the breastfeeding is going to end, and nobody knows if something's going to continue, or we can just start working with her by what I can in the restricted resources area. And so that by using this resources, we work with her time, and in 2 months the number of points has decreased drastically, and I was not able to treat her. This is the really complex case, and psychiatrists could have taken her, but I moved her to the status when she had improvement in the symptoms and she was ready. She had the efforts and everything else, and to start taking medication. And so I did not were able to treat this lady, but this is one of the success stories when the fact that the person actually reached out to the treatment. This was a big line of work. I don't know whether it was thoughtful or useful, but to the third part, thank you. To the third part of the story has happened 2 weeks ago. And we are master trainers in image gap, and so are trying to persuade every doctor, you need this, you need this, you need this. Every doctor is there throwing away the manual and then picks it back in a month. So that the story happened 2 weeks ago. I've been in Kherson, and so we were consulting and helping the patient for patients and the deoccupied villages where there was nobody there. Like there might be like a nurse or a felcher or a doctor's assistant. So we admitted there and fully destroyed ambulatory or the primary care center, or remains of that. Let's put it that way. It's hard to even be there. It's just hard to present this to anybody. And so the felcher brought me to the lady. I just want you to consult her because she has hypertensive episodes all the time. And so, okay, if she's hypertensive, this is my line of work, and that's okay. And so when we started to speak with her, she remembered that she'd been under occupation, and when she remembered that about the occupants, she lost the eyesight. Like the people who went through traumatic events, they have like it's called on the 2,000 yards eyes. So that she was looking nowhere, and she started to have different symptoms. She started to cry, moan, ask to be left alone. She had the flashback. This wasn't hypertensive. And when I found out that she had all of the classical symptoms of PTSD when it was treated as a hypertensive episode, she told me that she was the occupants killed their grandson and anything that's left from him, which is his car, and they were asking for them to give the keys. This is the only thing that I have from the grandson. You can kill me, but I'm not going to give you the keys. So they were putting her for torture, and so they decided not to kill her. They just destroyed the car and just left her and her car and her PTSD. Did this felcher know how to provide care for her? She did not. She did not pass through the image gap, but she stayed there apart from a lot of people who left, and independently in all her situation, she is there. She's working there in those destroyed ambulatory, and she is helping those people with what she can. And therefore, we wanted to say that image gap, this is not about just the information, about the tool, about the books. This is also about the networking, because now I know a lot of you here, and we work together and any other organization. And for today, for this voucher, as in 2 minutes before a presentation, I've agreed upon that from our organization, they should be brought to Mykolaiv, since in Kherson we can do the training because of the shelling and everything else, and they will pay for the transportation and lodging, and so she will be able to get this knowledge to help the people in conditions where there's no psychiatrist, no psychologist, no cellular connection, and like no medication. And I think that this is the bare minimum that we do have to provide for our people in cases of humanitarian crisis. What we wanted to mention, essentially, we wanted to tell you a different story, but this is what happens until we go to the stage. All the stories are changing. Those are just 3 stories. and we just took in different stories.
Саме як і в будь-якого сімейного лікаря, який працює тут, я бачу ваші лиця і бачу, що
I see your faces and I see that you're nodding, and everybody has those stories. As we are teaching doctors, and we understand that each and every doctor has 2,000 more patients, and these 2,000 patients are receiving this kind of services, and apart from their own patients, we are having like the goosebumps essentially. This is such a nice thing that we were able to help to tens of thousands of people in Ukraine, and take into account the protection of their mental health. And what's nice to think to the ending, this happened on the go. I just saw here Ivan Kuchik, the family doctor from Zakarpattia. There's so many family doctors here. Ivan, Olga, Turenska, and nurses, Alva Kujel and others. So there are many people and nurses and doctors, and from your name, I just like to say on your behalf. So Ivan, who didn't say, he is also consulting patients on the go. Like the person with the fever, the child with the fever, this is about us. This is what is characteristic of us. And a lot of people are going for the option to their work in the morning and going down late in the evening. This is just work for them, right? You came there, you've been paid for, and 1 day, 2 days, and after that, the ambulatory on all of that. So the going there and back, everybody's greeting us, and so when we are going to the store, everybody's welcoming us. We are living in this community, and this is not just work. We are a part of them. They're calling us in the morning. You have a boy being born, 350, mother is this and that, and please admit her. Sometimes they are saying Maxim is dead, and I don't know how to live on with that. And we are getting veterans, and unfortunately, we can't. We are taking all of them. And from all the family doctors who are listening to us, and from all the we've started to do this long ago, and we are continuing to do so from now up until our victory, and even after our victory, and then even more a bit so. This is not our work, this is our life. Thank you. I just don't need to ask for applause, so thank you so much, everybody.
Дякую, Ігор, Настю, за те, що ви, в принципі, робите. Не просто за те, що ви тут зараз розповідали.
Thank you for just being, and thank you for just existing and encouraging others to follow your example. Thank you all so much. And we are just scaling up and trying to do so all the time, from the local to global. And so now what we are trying to do is to study or to take some experience that we have in different places. So now we're going to have 2 presentations on the country's examples and reflection on integrated mental health services that are being developed during B forums and or emergency response measures. We will hear 2 stories, one from France, another from Czech Republic, and we'll start from the France. I would just like to welcome here Simone Wasserbachl, and she presents the Center for Mental Health from Lille, France, and it's WHO Cooperation Center from France as well. So Simone, the floor is yours.
Can you hear me well? Yes, perfect. My name is Simon Wasserbachl. I'm a clinical psychologist by training. I've worked for 15 years in a mental health service in Lille, very north of France, the service that Lady Lazari kindly mentioned this morning. I have slides. I guess they will just arrive. Now I'm a program director at the WHO Collaborating Center in Lille for research and training in mental health. And I'm also working at the Ministry of Health at the Ministerial Delegation for Mental Health and Training. So I'm really glad to be here, contribute to the debates, and also learn from the international innovation perspectives and experiences, and I must say that I'm already impressed. So just for you to know where I'm talking from, as a collaborating center, we have 4 terms of reference. The first one, and this is the term of reference that is really linked with the theme of this session, is to assist WHO in promoting and documenting the development of city-integrated mental health services. So that's a long name for integrated mental health. We also worked with the Quality Rights Program, and I know that on day 3 there will be sessions on this tool. The third term of reference is the promotion and the participation of users and family carers in mental health care services, in the organization of services, but also in research and in training. This point is really crucial, and it has been mentioned this morning, participation of people with lived experience. And the fourth term of reference is the work on e-mental health. So, very quickly, the idea of this presentation is to give you some example. It's not an exhaustive presentation, but it's just to share some ideas at different level, policy level, national level, research level, and local level. A word on the French roadmap for mental health and psychiatry, starting in 2018, with 3 pillars: the promotion of mental and well-being, of course, the coordination of high-quality services, and the third pillar is around citizenship, full citizenship for everyone. In this roadmap, there are 50 actions. Of course, I won't list those 50 actions, but I just want to, I picked up some examples. So action number 2 is related to mental health in the workplace. Number 4, train students in mental health first aid. Also, we have perinatal actions, really important actions in our daily practices is to reduce coercion. Number 31, research program in the field of mental health and psychiatry. And number 34, foster the emergence of professional peers. I was talking of peer expertise, but professional peer expertise is really an interesting step in the organization of mental health service. At the national level, again, some example and some actions to integrate mental health, the role of psychologists. That's not because I am a psychologist, but this is a big work in France. The situation is that we have psychologists working in the private sector, psychologists working in the public sector, mainly in public mental health services, who are really overloaded for now. So the idea is to give access to a reimbursed consultation of psychologists, and also to strengthen other facilities with psychologists. We also have actions on perinatal mental health with the PASS project, PASS program. I guess some of you know this program. And also an action on the articulation of the layers of the health system with mental health. We have communities of professionals at the territorial level. We also have a territorial project for mental health. We also have local mental health councils. So as you can imagine, it's a bit difficult to find your way between those different layers. So this need of articulation is really needed for the professional, but also for the people that will use, that are using mental health services. This is a card, a map of France. France mental health services in France are geographically organized, and we have more than 800 mental health services in France with different organizations. So it's kind of 800 different models with different resources on the staff level. Those colors are declination of how well those different services are staffed. So you can see that they are in white mainly, geographical areas where there are more difficulties. So it's just to share with you that either we have a high level of resources, those resources are not well dispatched on the national territory. About research and innovative practices, again, to share some example on how a collaborating center can help to integrate mental health in general health. We have a diploma called Community Mental Health Studies and Initiatives. For now, it's with 3 universities in France, Lille, Paris, and Marseille. And the idea is to train together mental health professionals, social workers, people with lived experience, and they will spend 1 week in the 3 cities and benefit from the experience of the local actors or from some experts. And also, they will be able to visit concrete organization and innovative practices. I already mentioned the PASS project, and I want to take 1 more minute on the local mental health councils that are organized with a platform that which is led by our collaborating center. And just to share with you that for now there are around 250 local mental health councils. Those councils are simply coordination platforms, so the idea is simple, of course, but to reach this objective of real coordination, you have to involve GPs, you have to involve police, you have to involve social workers, you have to involve the municipal teams, and this platform is led by the mayor of a city in coordination with the public psychiatric services, mental health services, and the idea is to share experience, to have a clear vision of what is ongoing on a very local territory. The main level of those councils is at the city level. And to finish this short presentation, I'd like to take again 1 more minute on the Lille East Suburbs service and to share with you the evolution of this service. You can see that the first column is 50 years ago with a number of patients in care around 600. 145 of them were hospitalized, and the number of beds for 100,000 inhabitants is 400, and the mean length of stay is 213. And you can see, if you read the lines, that working at the very local level, making partnerships, trying to implement WHO recommendation with our WHO collaborating center led to some results. The first result is that there are many more people accompanied by the mental health services, but with a number of beds that is really reduced, as you can see. The length of stay also, and the number of ambulatory acts, and the percentage of staff working in the community rising from 1% to 78%. So just to share that with some time, and when you share the innovative practices, when you share experience at the international level, of course, but also within within one team and with time. But I hope that for now it will need less time than that to change things, of course. This is how we try to convince also decision makers. And to finish, maybe three ideas I'd like to share to conclude. It's that integrated mental health means, I think, a cross-sectoral approach, so an interministerial cooperation. We also think that to reach those objectives, a dedicated team at national level is really helpful and, in fact, needed to ensure the follow-up of the mental health policies, so top-down approach, but also to gather expertise and innovation from the field, bottom-up approach, and international cooperation. So I hope we'll stay creative and curious, and I will finish as I started, because since this morning, what I learned from the Ukrainian system is really impressive, so I'm impressed, and thank you for that.
Дякую надзвичайно. Merci.
Thank you so much. And I would just like to remind you that we don't have the Q&A. I see that you are noting down everything that is happening here. This is a nice thing to see, but in any case, almost all of our speakers, they are still today, tomorrow, and the day after today will be with us. So in any case, you can just walk to them and to approach them to have a quick networking, essentially, to establish and to solve all the questions. So now for friends, I'd just like to invite Petra Winkler, Director of National Institute of Mental Health from Czech Republic. Thank you.
Thank you very much. Hello, ladies and gentlemen. Thank you for having me here. And I'm going to share a couple of glimpses of how we approach integrating mental health services in Czechia. To start with, there were times when we described mental health care systems using this pyramid. Pretty simple. You start with self-care. Everyone is responsible for his or her own mental health. And then you go up to the pyramid through informal community care, to mental health services in primary health care, to specialized community mental health services, up to long-stay facilities. Pretty simple, pretty easy, happy times, despite the fact that it's not pretty accurate, which is why in 2022, the WHO came up with this kind of description of mental health systems, which is much more accurate, but also much more difficult to comprehend, and I'm glad that Deborah already took you through this figure already in her presentation. So you have different services in different sectors, starting obviously from the mental health care specialized services, but also services in, for instance, perinatal health care, or in prisons, or in schools, or all around the society actually, which actually exposes the fact that mental health is a cross-sectional theme, but it makes the whole integration of mental health care more difficult. And we can think of integration of mental health care in basically two dimensions. Integration across different sectors, such as integrating healthcare services with social care services, or in terms of integration of mental health care within the healthcare sector, such as integrating mental health care into primary health care. And I will give you a couple of examples how we deal with this situation in our country. It's not going to be exhaustive because I have only a couple of minutes, but it's to share how actually difficult it is to achieve the balanced system. And I'm also glad that Lydia emphasized that she has not seen a country where this would work ideally. Exposing the fact that this is a long-term journey which probably never ends. So integration across different sectors in our country. One of the examples that I want to use is integrating health and social care sectors, and the example of community mental health teams which we established during the mental health care reform in our country. The main aim of which has been to deinstitutionalize a mental health care system in the Czech Republic. So we have had some social care services that operated in community and provided community mental health care, but there were no psychiatrists or other healthcare professionals working in these services. And what we have been doing during the reform is that we actually put these two components all together, so we could have teams that would have both healthcare professionals and social care professionals, which was incredibly difficult because the law that was valid in that time didn't allow social care team to share the documentation about the patient with the healthcare team and the vice versa. Also, the financing was very difficult because healthcare part of the team is financed from the public health insurance, whereas social part of the team is financed via Ministry of Labor and Social Affairs. And to put it all together and make it digestible for the payers of the care, it's very difficult. It's been a very difficult challenge in my country, and I believe that this is valid for some other countries too. So, but we achieved that. That was good. But we have many other social care services, such as halfway houses, which are for people who have been grown up in institutional care. And obviously, these children and adolescents have many mental health needs. And within these social care facilities, we don't have any valid guidelines, education, integration with other healthcare services. Everything is being done intuitively so far. So that would not be a very good example of integration, and it's something that is ahead of us to work on. The other examples would include health and justice. This is something that we don't think often about, but one of the great problems in my country is related to cooperation between these two sectors, because they are both involved in involuntary treatment. And we have cases, for instance, I know about a boy who is now 16 years old. When he was 14, he had his first episode of psychosis. He was a little bit aggressive to people around him, so he was involuntarily hospitalized. Court approved that, and for 2 years, the court has not been able to decide, despite this person is now well stabilized for 2 years, the court has not been able to decide that this person does not need involuntary hospitalization anymore. So instead of going to schools, being with his peers, etc., he is secluded in psychiatric hospital. So that's an example where these sectors do not work together very well. Other example, health and education, which is tremendously important. Just consider the fact that most of the common mental health problems have onset during the childhood or adolescence. So mental health in schools as a prevention, promotion programs, early detection, early intervention of mental health problems is quite important topic. This has not been a case in Czech Republic for a long time. Ministry of Youth Education and Sport was not very receptive to this topic until the pandemic. Because during the pandemic, mental health problems among children skyrocketed, and the Ministry of Youth Education and Sport on a daily basis got the phone calls from teachers like, what shall I do? I have pupils in my class who are self-harming and I don't know what to do about it. So that's the time when during the pandemic, Ministry of Health and Ministry of Youth Education and Sport became receptive to this topic and started to work on this. So nowadays there is a recommendation of the ministry that every school needs to have a school psychologist, etc. And this is now slowly changing. So I would put a question mark on this in terms of success. And the other theme, integration within healthcare sectors. The good example that we have in our country is perinatal mental health. In basically every maternity hospital now, we have a screening for mental health problems. We have healthcare workers who are well educated by our team how to deal with such a problems. So that's a good example of the integration of care. In primary healthcare, I would put a question mark because we enabled our GPs to prescribe anxiolytics and antidepressants. However, what we see in practice that this has not been complemented with proper education. So GPs are over-prescribing anxiolytics because their effect is immediate and they don't need to wait a couple of weeks for antidepressant to take effect. And what we see as a result is that we have people who are addicted to benzodiazepines. So that would be a question mark whether this is a good achievement or not. And the example of non-integrated care would be, for instance, in oncology care, where obviously people who have been diagnosed with cancer have very many mental health needs which are not systematically taken care of. So these were just a couple of examples of how incredibly difficult it is to achieve integrated care across all the services that you might have, across the services that you've seen in the figure that was presented firstly by Devorah and then at the beginning of this presentation. And my take-home message would be, you cannot achieve integrated care unless there is a strong political leadership for this, because you need all these different stakeholders to collaborate. And I'm actually very happy what I have been seeing here at this forum, which is that such a strong dedication is here in Ukraine. So I believe that you are on a good path, and I wish you all the best to move forward with this. Thank you.
Дякую надзвичайно. Thank you so much.
Thank you very much. Ladies and gentlemen, let's give another round of applause to our speaker from the Czech Republic. Thank you very much, Petr. And we are about to yet again change the format of our work. So from solo speeches, we will segue into a panel discussion, and there are multiple topics that can be hashed out. So it's a great delight of mine to announce our first panel discussion entitled Specialist Community Mental Health Services. And the centerpiece of this panel discussion is outreach multidisciplinary teams. While they are prepping everything for our panel discussion, I will start inviting the participants up here. So ladies and gentlemen, please give a rapturous round of applause to the panelists. Ms. Aliza Ladek-Brizgalova, Mental Health Program Lead, WHO Country Office in Ukraine. It's a great pleasure of mine to invite up here Ms. Anna Koba, psychiatrist and lead of the Community Mental Health Team in Ivano-Frankivsk, Ukraine. I also want to invite up here Ms. Irina Filik, psychiatric nurse. She represents the city of Chernivtsi in Ukraine. It's also a pleasure of mine to invite up here Mr. Oleksiy Skripachenko. He's an expert by experience, so he's a user of services of the Community Mental Health Team, Vinnytsia, Ukraine. And our last but not least panelist is Tatiana Gordienko, psychologist of the Community Mental Health Team, also from the city of Vinnytsia. And while our panelists are taking their seats, I would like to give the floor to the moderator of this panel discussion, Ms. Casey Redlick, who represents WHO Regional Office for Europe, and Casey will be moderating this panel discussion.
And I think before we start the panel discussion, we're going to have a short video. So I'll hand over.
Я ж на Кузнецах вчився. Фамилия Коваль, и думаю...
My surname is Koval. He's been ill for quite a long time. He used to get to the hospital once a year. It's difficult to be there. I was depressed, always depressed when I was hospitalized. I just wish he were healthier, at least a little bit. He lives with his mother, and they were very surprised when we came to them on our own. We selected the necessary medicines, and a psychologist works with him. He talks to them, and then he feels better. And over the past 2 years, he has not been hospitalized, and looking at him, I doubt that he will make it there anytime shortly. I grow roses. I work in a carpentry shop. I'm a tinsmith myself. My father taught me to do that. I play chess. I watch movies, and I also want to start a smoothie.
Okay, so we'll start the panel now. So I have to say it's my absolute honour and privilege to be here at the forum with you, but also from a personal perspective to be able to moderate this session. This is an area which is very close to my heart. I started my career on a mobile outreach team half a world away in my home country in Australia, but also in 2015, I had the extraordinary opportunity to come to Ukraine and support setting up these community mental health teams alongside Alyssa and an extraordinary and dedicated team here in the country. I think at the time, of course, we were hopeful that this would be an acceptable and a sustainable model for the country. I'm not sure that we expected that 7 years down the track we would be here on a stage having a deep dive session on these teams which are now multiplied across the country. We had 4 tiny teams in 4 corners of enormous country that is Ukraine back then. Now we have more than 80 teams serving thousands of people. So it is a great pleasure to be here. And I think just to put this session in context, we've heard this morning about the networks and frameworks to guide development of effective community-based mental health services. We've heard about the recipe that we need to bake the perfect mental health reform. We've heard then about the opportunities that come with being able to expand mental health services through primary health care and just now through integrated mental health care models. So now we're moving to more specialist mental health services. So we're thinking about still services delivered in community settings, supporting people with perhaps more severe or complex mental health conditions. They might be at times when people are acutely unwell, who may have been discharged from hospital, or who might need more intensive support in their rehabilitation and their recovery process. And we have the perfect panel here, I think, today to hear more about how these teams actually operate. We have the people on the ground doing the work who understand what it's like to work on these teams and what it means to transform mental health services to really meet the needs of people, literally in the places and spaces where they're living, in their homes, in their communities. So, without further ado, I'm going to start by asking Alyssa. So we're not in order today. I hope all right and not too confusing. But I want to ask Alyssa a big question to start with. I think it will have an equally big answer. So we know community mental health teams, they look different in different countries, in different contexts. They might have different functions, different roles. They might serve different populations even. But Alyssa, can you tell us a little bit more in some more detail about what community mental health teams actually look like in Ukraine? And perhaps a bit about how the model was first developed. And then most importantly, I think, why the model is needed.
Thank you very much, Casey. Colleagues, friends, I put together a short PowerPoint presentation. Thank you for having projected it on the screen. While implementing this service since 2015, we've been inundated with questions. What is this? Why do we need it? Why can't we just work the way we did in the past? And I would like to start by saying that if we answer this question, we need to answer another question first. How do we see our life to start with? This service should be available out there so that a person, regardless of their mental condition, be able to live in a community, rejoice, move around, dream, get disappointed, fight, plan. So we want our people to be able to do all these things. The World Health Organization embarked on the implementation of this service back in 2015. We had a pilot project in cooperation with the Ministry of Health of Ukraine. And this implementation was part and parcel of the humanitarian response back then, as referenced by Casey. But within a short time frame, we realized that this model had a greater potential for Ukraine. There was a lot of planning behind the scenes, work-related anxiety, multiple discussions within the team, with the MOH team, whether this model will work, whether it will be successful or not, what are some of the showcases from other countries that we can successfully implement in Ukraine, what will not work in Ukraine, how do we change our mindset, how do we transform our approaches, how do we alter the practices of our medical professionals. And we have medical professionals with substantial experience under their belts of working as part of a different model. So these are the questions that we tried really hard to answer as a team. And to be frank and candid, we are still looking for some of the answers. At the same time, we started receiving some feedback from the service users as well as from the service providers. They started saying, once you give it a try, you don't want anything else. You don't want anything different. And that was a crucial marker for us. That was basically an important milestone that instilled confidence in us that we were on the right track, that we had to continue moving down this pathway. And later, all these thoughts were corroborated by data, but I will talk about that a little bit later. So since 2015, or from 2015 through 2021, we invested a lot of work and effort. We invested in building dialogue. It was a very intensive process in cooperation with the Ministry of Health of Ukraine, the National Health Service of Ukraine. We analyzed and explored the experiences of other countries, Australia, the UK, Turkey, Georgia, the Netherlands, and whatnot. And most importantly, we also perused the experience of our Ukrainian teams, because basically they were already operating. We started with 4 teams, and then their numbers started swelling up. So day in, day out, we were in dialogue with the doctors, with the team members, with the service users, and we tried to craft joint practical solutions. First and foremost, we wanted to understand how to communicate the essence of this service to our colleagues and all healthcare professionals. How to explain it to the chief doctor that these teams require their own vehicle. It's an important piece. How do we engage patients into this new model? So there were multiple work-related nuances and facets that we had to attend to by joint forces. And by 2021, we had already elaborated a Ukrainian model of what we call outreach multidisciplinary teams or community mental health teams. And as it has already been referenced, it's not just about the model. It's important to have robust political will and support, and it has to be timely. So due timing is another important ingredient here, because you want to make sure that this tested and trial model will become sustainable. So all those factors were present. In 2017, the mental health concept for Ukraine was adopted, and this concept prioritized the development of community-based mental health services. The healthcare reform was launched as well. In 2021, the Ministry of Health of Ukraine and the National Health Service of Ukraine transitioned to yet another stage, which is specialist services. Therefore, in June 2021, this service became sustainable, it was steady on its feet, and it became one of the packages within the public program of medical guarantees. And this service is still in the making. It's a work in progress. In 2021, we had 61 teams. As of today, we have 83 teams. At the same time, if we have a look at the number of patients receiving care from the teams, the number doubles year in, year out. In Ukraine, we call this service mobile teams. And because of this word mobile, it gets mixed up with something emergency, acute, or short-term, which is a fallacious concept because basically it's about long-term care for people with more severe forms of mental health issues. And based on our experience in Ukraine, we can see that this care lasts for at least 6 months. The team is comprised of a psychiatrist, social worker, psychologist, medical nurse. This team has their own vehicle. This team can operate within a community. It's one of the advantages of the service. But in certain cases or at a certain stage of treatment, the team might also invite some of the patients to their office. What does the work look like within the team? Just a very quick illustration because I believe that is paramount. I can share my first-hand experience of working as part of the psychiatric service. I did my training in psychiatry in Ukraine, and I have some hands-on experience as well. So photographs like this were really strange or weird because these are the photographs that are not associated with psychiatric care or mental health care. But right now, this is part and parcel of our reality. I can see teams with smiles plastered on their faces. I can see a lot of familiar faces. Nowadays, you can indeed receive this service in your community. You can bump into a person in a park. You can have a conversation on the way home. You can have a home visit. You can meet up in a cafe or some other place. So basically, this service doesn't really have any barriers whatsoever. And this is something that motivates both the team and the person to be creative, to be innovative, and it's recovery-oriented because this context is all about recovery, and it offers a great opportunity for any person to get recovered in their community, in their milieu. But it was not only about the model per se. We also started devising the training program. We had several rounds of training, and with each and every round, we wanted to refine and polish the training program, grounded in the feedback obtained from the participants, from our professionals. We also consulted with both domestic and international trainers and colleagues. And the program looks as follows. So it starts with basic training on SOPs, standard operating procedures. Then we offer a series of trainings on interventions, evidence-based psychological interventions, like, for example, motivational interviewing, CBP. And recently, for obvious reasons, we also incorporated stress management training. We also offer a series of supervisions. We tested and trialed different formats and ways of supervisions, but based on the received feedback, we decided that the minimum number of supervisions should amount to 26 hours, and then we can also offer some on-request supervisions. Interventions are a crucial component as well. We do understand that the resources provided by international organizations are not infinite. So one of our objectives is to make sure that this model is sustainable. In this context, interventions play a key role. And I am exhilarated to share that our training team, that includes Anna and some other colleagues from the audience, these are basically people who were the first ones to complete our training, but now they are training other people. So we have our own in-house community of trainers, and they do so based on their personal experience and based on their own training. So I believe that it's another important factor that comes into play. From the perspective of sustainability, we also had a conversation with the National Health Service of Ukraine. As you know, we have MHGAP training online, so we believe that we can replicate this success story for community mental health teams, because the WHO has trained about 36 teams, but this is not the extent of it. And there are some limitations on how many teams we can train offline. So we believe that online training opportunities would expand our potential and prospects. We are also entertaining the idea of incorporating this training program into the educational process. We believe that this curriculum is pretty finalized. And we also want to offer this training with the involvement of people with lived experience, basically those people that are experts because they have this first-hand experience. We believe they also need to be integrated into the service. A couple of words about the evaluation or assessment of these teams, especially the performance of the teams. It's hard to evaluate, because basically we are trying to evaluate different pieces of a human life. But that said, we try to analyze the outcomes and the results accomplished by community and mental health teams. So I would like to share some of the insights and findings that we have garnered as part of our routine monitoring process. We compared the number of hospitalizations of our service users. So basically it's 1 year before they started using the service and 1 year into the service. On this slide, you can see that the number of hospitalizations dropped about 6.5-fold. We did some math for ourselves, and there's a very important number here. So what does it mean for these people? Basically, these people spent additional 5,345 days in their family, at home, in their community, with their dear ones, with their friends. And it means that they spend more days living a full-fledged life. We also collected data on the reduction of mental health disorder severity. We used the WHO DAS and CGI scales to this end. There's another important aspect that I would like to draw your attention to. We made some calculations, and by the way, we had a sample of 1,308 patients, if my memory serves me right. And out of them, 9 people were able to resume their studies, and about 106 people resumed their employment or started their employment. 115 people in total. You might say that from a statistical perspective, it's not a lot, considering the sample that we analyzed. I fully concur with you that it's not a hefty number. But each and every number is about a human story. It's about a human life. To my left, you can see a medical nurse and psychologist from Slavyansk. what was the story there? A young person, because of mental health disorder, had a risk of interrupting their higher education. So basically, this lady was looking into interrupting her studies, but then she approached the service, she received some care, she started feeling better, the symptoms reduced, and her condition was pretty stable. And then the question arose that she had to return to studies because the summer holidays were over, so it was high time to return to studies. And this lady said, you know what, everything is fine, I'm feeling pretty well, but like in the morning, I got ready, I packed up, but there's something missing. I'm not really ready to open the door and go outside. What did the team do? It might sound like a minor thing, but it's a genuine innovation. It's basically a manifestation of creativity for us. They agreed with this person that they would call him or her at the specific hour, 10 or 15 minutes before this person had to leave, and they would just say, hi there, how are you doing? Are you going to university? And this is something that worked miracles. So my point here is that they didn't really have to invest that much. They basically had to invest 1 minute in having a brief exchange with this person in the morning. But the result was just colossal, because basically this person remained in university and successfully obtained a higher education. So it's not just about the numbers. And the last message, the most important one that I want to communicate about this service, the symptoms, disability, or mental health disorders do not mean that this is an end to your dreams, expectations, or hopes. Recovery is grounded in hope, in optimism about the future. And the crux of hope as part of the recovery process is that it's possible to have a full-fledged life regardless of whether you have some symptoms or not. So this service is human-oriented, human-centered in the first place. Thank you.
I think it's exceptionally powerful. You know, it's one thing to talk about models and how teams look and what they do, but another thing to hear about the impact for people's lives. That's why we do what we do. So thank you for a very comprehensive response to my question. My next question is to Anna. I'm keen to hear from you because I think we always knew that psychiatrists would be critical to the success of these teams. Ukraine has such a strong network of psychiatrists across the country. We needed the buy-in and the support of psychiatrists working in the field. My question is, you've worked in other settings before coming to these teams. Can you tell me what it's like and how it's different to work in a community mental health team? And perhaps a bit about how your perception has changed about the way that you work since starting working in this way.
Thank you so much for the question, and thank you for your kind words. I'd just like to welcome everybody, and it's such a nice, I'm so happy to do so, and to be, to the audience, thank you so much. Maybe I can hear that I'm speaking too fast, so I do beg your pardon for that. Regarding the fact like how to work with the psychiatrist in this team, this is a really interesting. But when we started, it was scary because there was no colleagues that had this knowledge right up front. And working in the inpatient conditions environment, yes, we can select a treatment, we can pick up the treatment, and we can improve their mental health status. But when they are going into the real world, we don't know what is happening. And when they were getting into hospital, we see that their conditions are worsening. We were interested in what had happened. Usually they did not take the medication, and not all of our patients, they were compliant to the treatment. Sometimes there have been different or other reasons, like the stressors, triggers, or there been like conflict situation, and with the relatives and others, and it was interesting for me, like, can you change this in any way? Can you influence to all of those things so that people would get less to the hospital? And so I worked in the polyclinic, and I'm still work there. And I can also communicate there more with the patient, and can observe them in the home and correct somehow the treatment in when they are at home and their social life. But there have been cases that I'm asking the patient, are you taking medication? They're saying yes, yes, and then it turns out that they don't. And it's not always that they didn't want to, it's just that they did not have a comprehensive understanding, and sometimes they have issues like they forgot to take them. This is also an issue that I've seen from the polyclinic. And one of the situations that has been important for me at times, there have been proceeded hospitalization or worsening in state of health, and was just the talk with the relatives by working in the polyclinics. And so now, by working for more than 2 years in the mobile teams, I can see that this is really the case. When we are not just teaching the person and the caregivers and what are the early symptoms, how can you prevent this for every person, and to the prescription and how this is working now. And so that the slide that was illustrated by Elisa, that the number of hospitalization has decreased significantly because people know how to correct their crisis themselves. And so this is why, this is what I really like in the mobile teams. But the most important thing and the most that I'm taking back, this is the atmosphere of communication with the patient. And in the polyclinics and in patient, they have the atmosphere like, I am an expert and you are the patient. I am a doctor and you are the patient. I will tell you what to do now and how I'll be treating you. But in a team, this is a completely different dynamic, and you can feel that. There's a partnership, there's peer-to-peer together with the clients, and we are consider them that they are the experts of their own life, that we can learn a lot from them. And so I think that this is what we are lacking a lot in the psychiatric care, just to hearing out the patient or the client and to hear what their needs are. When they work in a mobile team, you have an ability to hear that, not only from the psychiatrist work, but also from the other specialists of the team. And this helps to solve not only the issues of the medicines, or maybe also mental health and improvement of life and functioning in the society, in the community, in the family. And this is awe-inspiring. And so that all the specialists that are hesitating, don't know how the team works, I'm saying it's wonderful. Thank you.
Thank you so much, Anna. I think the enthusiasm and the love of the work comes through so strongly. I think that will be a theme today during this session. So my next question is to Irina. And I'm also interested in hearing from you because, of course, nurses are a vital component. And I'm going to ask you about this sort of the multidisciplinarity of these teams. So, this is one of the core components really across the world of community mental health teams, that they have a multidisciplinary workforce working together to support their clients' mental health needs. And I wonder how it works here in Ukraine, because it works in different ways in different countries. So can you tell me a bit about how different disciplines work together within these community mental health teams in Ukraine?
Дякую.
Yeah, no, so, okay. So the team is multidisciplinary. The doctor psychiatrist is giving the schedule for treatment. He does the pharmacotherapy. Psychologist does the psychosocial correction, behavior correction, psychotherapeutical treatment. Social worker themselves, without the social worker, this line of work, it's almost impossible since the social factors for a person is almost the first place in all. The team provides psychosocial works not separately, so like psychological, psychiatric, and other, so that the treatment of and the work of psychologists separately, the social work, and the team is providing in together the psychosocial work for the patient. And I would just like to touch base upon the work of medical nurse because I'm not one. When I started to work at the team, in the mobile brigade, this was a completely different thing. And I think that I have the wings on my sleeves and I started to want to work. And this is such a drive or a push to work. And so what was the work of the nurse that we have? The doctor prescribes the treatment, you did the manipulation or intervention, and so then you don't have the right to say anything because you are fulfilling like the main objectives of the medical nurse is just to fulfill the provisions that the doctors made. And so the mobile team, the nurse, apart from the manipulation and the main nursing things, they also do a line of intensive psychotherapeutic interventions that have spread out the circle of what the nurse can do so that the environment at work, and if in our healthcare this is there is like a vertical separation of power, so there is a leadership and there is a in this final work, there is a horizontal interaction. There is no leader. There is no subordinate. Everybody is interreplaceable in the level of the competencies that they have. But the interactions in the community and the line of work in this brigade or unit, this is the model of the healthy society. And this model of healthy society is being passed on to the patient. It's being passed to their relatives. And so they are trusting more to us. They want to work with us in that way. I hope I answered your question.
Absolutely. Thank you so much. And it reminds me that really, I think all disciplines benefit from working in community teams. Everyone gets to expand their scope of practice in a way which is so motivating that I think it really keeps people in this work. So thank you. So Alexei, my next question is to you. And really, I think we'd all agree that your perspective is the most important on this panel, because I think if these community teams don't work for the people that they're aiming to serve, then they've failed. We need them to be appropriate and meeting people's needs. So can you tell me a little bit and tell all of us about your experience working with a community mental health team?
Greetings to everybody who's healthy. And I will be telling you about the mobile brigades and mobile teams, and maybe not things that everybody wants to hear or thinking of. And I am really satisfied that I was in such a team, I'm so happy that I'm being provided with care and support. And there are many differences before and after when I just got to that environment and before I got to that environment. I can also tell you that me personally, the mobile team was not always needed. For me, it was easier to move out alone to the office where we can just have a talk, when I can just go to the city and I can feel myself as an acting person that it just doesn't sit at home. For me, for example, the nurse, for example, the help of nurses was not needed before. And the team might not be all going there all together, because then I feel like I am a sick person, but that can be told about us as well. And maybe they are also can have this. But the other thing is that what I want to clarify is that unfortunately I don't see well, and if you need to, you just need to give me a signal or something else. because I am have a visual disruption apart from that, and also it was interesting for me to see the team for the first time, and I am I have do the blogging, and so I have a big studio with the monitors and everything else at home, and the team was satisfied that I have like a line of activity, and there was a nice thing that I'm writing songs and I'm writing other things, and so that the team did support in a lot of ways. Tatiana Alexandrovna was the most in communication with all of us, and this was this whole atmosphere that you're not left alone. Some doctors are afraid that I live alone, that we approve this with the parents, and this team, this is the second line of family after my father. I also like to add that I've mentioned at the beginning what to do, want to do with the collective, that we have classes and with other participants of such people who need support. And you know, this moment means a lot, like the discussion and peer-to-peer level interactions. We are sharing our experience, maybe somebody gives advice on how to live and how to support each other, and so this moment is really important personally for me, maybe because I'm an extroverted person. And so this is how it happens for me. Maybe you have other questions, but I hope I answered your question.
You absolutely did. Thank you so much. So my next question goes to Tatiana down the end. I think for most of us who have worked in community teams, but I think watching from the outside, it seems like they really allow for a flexibility and a creativity and a freedom perhaps in our work that's not available in other more clinical settings. Can you tell me if that's been something that you've experienced, if you've found that you've been able to be more creative in your work, and how? And perhaps a bit about how that might have impacted on the people that you've worked with.
So it happens in the following way. The creativeness is the continuous process for one's development. So like you learn, and this is the creative approach and how the team works. And directly our clients, and they are motivating for me to develop. I can honestly say that each and every time this is something different, it causes me to want to develop. But I am practicing it in a way when I'm gathering like a group. I'm also trying to clarify what is their request for the following change. What would you want to learn? Is this something more theoretical or academic, or do you have a topic of interest? So I'm trying to push from what is being asked of me by my clients. Usually this brings joy to me because this is my personal development as well. And I really like this line of work specifically since I see the results on how much they feel the difference and the dynamics and how they were treated before and how they can be heard, they be listened to. As Alexei mentioned, not missing a training, he is participating really actively and gives us a push that you don't need to stop, you need to move forward independently of any symptoms, anything that is prohibiting you to live, you can work, and you can move forward. Therefore, we, near clients, we are becoming creative and artistic because this helps us to prepare something new and something extraordinary. Thank you so much.
Thank you. I hope that we'll get some new recruits from the team from this from this session, because really it seems like it's a way of working that really appeals for a lot of different reasons. And we've got a bit of time, thankfully, so I've got a few follow-up questions that I hope it's all right to ask. So I might, if Anna, I can ask you first. You're now training, and you're training the new generation of community health workers who will work in these teams going forward. Can you tell us about what they need when they're coming into a training, what they need from you as a trainer, and how you see the change in their practice after the training is finished?
Дякую за запитання.
Thank you so much for the question. This is my another role, and it's an interesting line of work that I'm so grateful to the mobile services, and also that I'm able to teach, and I found myself in that as a part of my life's objectives to teach others. By teaching other teams, what I mentioned and noticed that the most important thing for them, what helps them a lot, to everybody grow, which is for their motivation, their wish to grow, to develop further. This concerns everybody, both the specialists that have lots of experience, that worked in different areas of mental health provision, and the ones who are just coming in to work and are just starting off their career. For all of them, the most important in my idea is that they want to learn. And now we see a lot of new teams that are really can be concerned as fast learners. They want to develop, they want to move forward, they want to implement everything that Elisa mentioned, which is cognitive behavioral therapy, motivational interviews, or other things that they want to do. They direly want to implement them in their service and the line of work. And so this motivation and will or strive to move forward, when you are working in somewhere where you want to, where your heart calls to, this is the most important thing, and the wish to help other clients or users. And therefore, for all of the other teams and for other people who are learning, I think that this is the most important thing, that to have this spark, the wish to move forward, to help, and to move forward. And from my side, what I'm trying to do is to bring fire to that spark. Thank you.
Thank you. You remind me of when we were doing the first round of training. I think Alyssa will remember that it was so obvious that people really loved working in this way. They were so excited to tell other people about it, and to see how they could work in ways that really seemed to be centering the client that they had in front of them. So thank you. I wondered if I could ask Alexei a quick follow-up question, just thinking about training and what you think are the most important components of a training program for people who are going to work in these teams.
I think that the support, the main thing is that the person needs to feel. So we have this issues or conditions in our society. If I'm, for example, can simply tell everybody that I had a number of conditions, but the society is not ready, and so this team, the trainers or the mobile unit and all those initiatives are helping, not me personally, but they are helping, as my opinion, the society, because the word is going around and they are informing, and this becomes so normalized in the society. Because in our society, in my opinion, there's a lot of people have mental issues and they're going around of us. And so this is a very unfortunate thing. And so after post-Soviet society has to be transformed, and those teams, those trainings, first and foremost, they have to work for the whole society and not just for me because I have issues.
That echoes something that we like to say in our team, is that we're all service users. We're all service users, we're potential service users. We need to not think so much about us and them, but think about what we want as a society. So thank you so much. I think it's such an important reflection. Can I perhaps go back to you, Irina, in thinking about multidisciplinary teams and being able to work with people with different skill sets and learn from them. Why do you think it's so important to have multidisciplinary community teams in Ukraine?
Do you know, there is so many factors, indicators for multidisciplinary team to be in existence in Ukraine that I'm afraid that I'll not be able to name all of them. Let's just get to remember the house facilities. First and foremost, the presence of the team in the house facility. This is economically profitable because when the payment for the work is not, it depends on the beds that we have, but the number of cases that we have or the number of patients that we have, this is economically better for the hospital. We can shorten the stay in the hospital and then be treated under the supervision of the mobile team. And also, first and foremost, this is that the person is, it's a human-oriented model, patient-oriented model, client, user, patient. So we don't even want to call this person a patient because this is indeed a client. He himself is participating in treatment. This person participates themselves in the treatment. When we were developing the recovery plans, they're planned not in a day, not in a week. Those plans are done for months and months. And so, of course, that in a time, this person, the objectives, the life's objectives is different. And so when they are putting the small goal, they are reaching out and they are able to achieve it. The team is needed. And here, there's no other words. The team is needed for us. And it was correctly mentioned by Alexei. This is our society. The stigma, unfortunately, we still have to fight it. And this is the line of work for. This has to be like forums like this. There has to be trainings. There have to be webinars, seminars, not only for medical employees, but for everybody. Thank you.
Thank you. Can I ask you, Tatiana, a follow-up question? I think you touched on this a little bit, but I wonder what you think the aspects of your work in the community mental health team that you find most meaningful for you as a professional and perhaps most meaningful for your clients, for the people that you're working with?
Thank you so much for the question. And I think that this is really important for the work with our clients and that have issues of mental health or mental health condition. When the person is just on the observation, supervision, when in hospital, they're not getting psychological support and care that that our mobile team provides. We are doing a lot communication methodology that we use. We are supportive them. In any case, we are always saying whenever you feel like there is a worry inside of your heart, that there are any symptoms done, please don't be afraid to mention them so that we can provide timely support for you and to directly or refer you in the correct way so that you would not have an exacerbation. And so this approach, the psychological approach, this is really important for all of our clients. They feel this and we see this on such a monitoring, like how they started to refer less for inpatient treatment. And they have a supportive treatment, there is a psychological support, and it is effective in our line of work. This is why I am so happy that those teams are established, because this is like a European approach that is really supportive of our clients, and they are also noting that they're not left alone, they're not left aboard, they're not a second sort people, or that they were just people that were worse than others. Right now, we are having them on the level that you are okay, you just have a chronic condition. That's it. A lot of people have chronic conditions. This is not something to be ashamed of. Now they finally have a different opinion. They are okay, they can move, they can live, they can move in the direction somebody wants to study, to work, and to move forward, and not just to sit in the hospital or just in four walls of their homes. This is why this is the line of work that we have, and we think that this is really highly important. Thank you.
I have a question for Alyssa, which is not planned. Please go ahead. And then I'll ask you a question.
Вибачте, я вирішила проактивно.
I've decided to proactively propose to have a comment on. I know that in our room there are many representatives of psychiatry service and colleague psychiatricians and psychologists that are working there, and I would just like to reinforce in one important moment that this service, maybe we didn't open up enough because we didn't have enough time. This service is not an objective to replace fully psychiatry or in hospital or hospitalized care, because there are cases when there's a high crisis that is developed and the person needs to be hospitalized. And this service is not contraindicative of that. And we are mentioning, when you heard in the video and the narratives of today, the hospitalizations are being prevented, which we are mentioning about the hospitalization that we could avoid, and hospitalizations that are caused because of the fact that, for example, the social issues are not solved. And I know that there are many things that all the colleagues from the psychiatry services know what we are mentioning here, or that there is not enough support from outside, and then the person is not attentive to what their status is, they don't have the support, and then later on the crisis repeats itself and they get back to the inpatient because or to the hospital, because there's no this service that would pick them up after the hospital treatment was ended. And this is why it's an additional service. This does not conflict against the psychiatric care, and so they have to fulfill and be complementary to one another. And the next thing that I would just also like to mention to the psychiatric service, maybe to comment on, and I am speaking to the colleague maybe that they're not familiar with the service themselves, the fact that this line exists doesn't mean that all the psychiatric service have to automatically reorganize themselves and to do the outpatient work and to work in the community. Yet again, this is a line of work by the will of heart or the call of heart. And so we are all different and all of the experts are different. Somebody more inclined to be mobile and somebody wants to be in the dynamic and in action, and it's comfortable to move out, to visit people, to be in the community. For somebody, it's more comfortable to be in the office and to provide services there.
It's not an ultimatum. It's just one of the elements that opens up opportunities for those people who have that need. And I also believe that it's a great window of opportunity for professionals. It's a great opportunity for further professional development and growth. So it's an important piece of the system in general. Thank you.
So it's an important clarification, I think, that this is not one or the other, but this is about complementary services. We don't have systems, that I can think of where we've eliminated inpatient care, and we're very lucky in this country, I think, to have such extraordinary, visionary psychiatrists who have led this process of reform. We've got a few minutes left. Can I ask you one quick question, Alyssa? Because we've talked a lot about the triumphs, I think, of this work and the things that people really value about these community teams. But change is hard. There are always challenges. Can you talk just a little bit about some of the greatest challenges that you've come up against and what you've learnt in trying to overcome those?
There were a multitude of them. I'm trying to put my finger in something more specific. I guess the key challenge is something that is not really unique to this service. It's a very typical challenge whenever you're implementing something new. And people don't have to know it, people don't have to understand or accept it by default. I guess this is the greatest challenge that the initial teams had to rise up to, and they had to heroically overcome this challenge. They were very innovative and creative about crafting solutions. Currently, this challenge is not that pertinent, but by interacting with the teams, I know very well that we still have a lot of work ahead of us, because the level of awareness in the professional community and in the community of service users and their family members is still very low. So we still need to do a lot of communication and clarification about what the service is and why it's important.
Sorry for putting you on the spot there. Okay, so we're at the end of the panel. We heard a lot. I think this was exactly what we intended, a deep dive into what community mental health teams look like in Ukraine. I think we really, from all your different perspectives, we get a really good understanding of what it looks like on the ground. I think about, buy-in for change is so integral for change being sustainable. And what I heard was that there is a huge amount of buy-in for this model because people really enjoy working in this way and they can see the benefits. So it's working for the staff who are part of these teams. It's working for the service users, the clients who are working with these teams. This is how we make change sustainable over time. So I just want everyone to join me in thanking our panelists for being so open and willing to share their experience. It's been fascinating. I'm sure if you want to know more, you probably have burning questions. You can grab them in one of the coffee breaks over the next few days and ask them more. So on behalf of everyone, I want to thank you all for being here and being part of this panel.
Дякуємо вам.
Thank you very much. Well, you don't have to stop. Keep clapping, keep clapping. I think well deserved. So thank you very much indeed for having shared your thoughts, knowledge, expertise, and experience. And I also want to extend my gratitude to you for having reminded us that you can approach all the participants, all the panelists, and ask them questions. I mean, if you have amassed a lot of questions, you can definitely ask them during coffee breaks, lunch breaks, and things like that. Well, but we still have one panel discussion before a coffee break. Or to be more precise, we will have another panel discussion after the coffee break. And now we will transition to solo presentations or speeches yet again. So we will have sort of reports, but also presentations. I do understand that you all are not well versed in all the processes, hence this forum today, because it's all about sharing some innovations, novelties, and accomplishments. So we will have a block comprising presentations on the topic community-level support and services implemented as part of emergency response. I would like to point out that you will be exposed to 3 presentations within this block. Our speakers are steadfast and ready, so they are ready to report, if I can put it this way. So let's get started. I would like to give the floor to Alona Gerasimova, who represents the USAID project, Public Health Systems Recovery and Resilience. Good afternoon, everyone. I'm delighted to be here. Thank you very much for this great opportunity to share my experience. I'm the lead of the USAID project entitled Public Health Systems Recovery and Resilience in Ukraine, and I'm also the director of PUB in Ukraine. So we're not a humanitarian organization. What we do is not really a humanitarian response. Together with our partners at national, regional, and local levels, we try to craft and devise systematic services. It's all about systematic or systemic solutions. But I would like to remind all of us that by dint of miracles, the Ukrainians continue crafting these systematic solutions under shellings, missile strikes, air raid alerts. We have people dying, we have people injured, we have people still fighting, we have people who were released from captivity, we have people who lost their dear ones. So we are talking about multiple systematic things today, but in the context that we need to continuously keep in mind. I think we have already adjusted to this new reality. It might sound scary, or maybe this is the recipe for our resilience, because we continue building, we continue elaborating solutions, but at the same time, we need to keep in mind that today we're talking about services for millions and millions of people. And that also includes service providers. You heard from Ihor and Anastasia today. They are service providers, and they are the heroes who definitely require our steadfast support. Let me veer back to the project. It's a 5-year USAID project. It's quite a broad and comprehensive project about the building of mental health in general. This project was launched before the full-scale war. Mental health was a small part of this project, but then we had to make some corrections because of the ongoing reality. Right now, mental health is a transversal and cross-cutting topic, and it's a big component of our work nowadays. So we view mental health as a part of public health in general. So when we embarked on our activities in Ukraine, we decided to utilize a very systematic and integrated approach. A couple of words about our geographic footprint. We operate in 8 regions of Ukraine. In all regions, we selected 2 focus communities. The idea of the project was to pilot this model, and if the model proved effective, we wanted to propose it for scaling and replication. So we started in 16 communities, and we started with community-based mapping. We employed MHGAP, the WHO tool, but not the training tool, but a platform for service delivery. We reviewed, explored, and mapped all the services available in communities. Not only healthcare, but we had a broader perspective. We encompassed social welfare, education, and multiple other sectors that exist at community level. We also explored diverse service providers, different settings, and all the types of services that they were offering. So we placed emphasis on specific interventions available to users. We also conducted a needs assessment. We interacted and conversed with community members, service users, leaders of these communities, because we wanted to hear from the horse's mouth what their vision for service development was. I will not really expound on that in detail here. Here you can see just an example of the dashboard resulting from mapping. So here you can see what kind of service providers we have, where we have them, what kind of interventions and services they offer. This tool is a very neat vehicle that is user-friendly. We shared it with our partners, the National Coordination Center in the first place. So basically, this tool is readily available and can be used in any interested community. So as a result, you receive this dashboard, and there you can see a crystal clear picture of the current reality. Since we are talking about community-based services, I would like to point out that we found out, as a result of this mapping, that these services were limited. And in terms of psychological support, the only available service is psychological support in schools, like, for example, school psychologists. The findings of the needs assessment are of avid interest as well. I would like to draw your attention to some of the figures on the slide. 7% of the respondents received mental health services, 30% know where to receive these services in their community. It takes us back to the context. We do understand that each and every one of us right now requires such services to this or that extent. 27% of the respondents would like to receive or would rather like to receive such services. But at the same time, community members have a need for free mental health services. And this is something that we heard from one of the international speakers. So the services are out there, but they are available as part of private practices, so not everyone can afford them. Community leaders are aware of the problems with mental health service delivery, and all respondents in focus groups indicated that the need for services was there, and it had increased since the outbreak of the full-scale war. We also heard from the respondents that in some of the communities there was full coverage by mental health services. Stigma is still there. It hasn't really vanished into thin air. We conducted focus group discussions, in-depth interviews. We also interviewed community members, and most respondents would like to receive services online or in other communities because the issue of stigma is a very serious impediment indeed. After the mapping and needs assessment, we realized that we had to offer training to professionals. So I have already pointed out that the only available community-based service was school psychology, in-person of school psychologists. So we decided to launch some training programs, WHO interventions, MHGAP, Self-Help Plus, CBT interventions, CETA model that has been referred to today. There's another model, mind-body medicine. It's yet another psychosocial support program. We came up with our own Ukrainian equivalent that is quite contentious. So there's a lot of disagreement about the Ukrainian name for this intervention, but nonetheless, when we delivered all these trainings and we implemented a wide array of services and we offered these services to community members. As for Self-Help Plus, this is something that we offer to healthcare professionals because they are in need of support as well. So there were multiple pieces of the puzzle. We tried to put them together, which resulted in a concept that I would like to briefly elaborate on. We entitled it the I Care for Myself space. What is the ground or rationale behind this concept? Well, first of all, we have some primary healthcare professionals who completed MHGAP training. They work in primary healthcare institutions and they successfully utilize these skills. As part of our project, we are piloting another model, PHC Plus. I'm pretty much sure that primary healthcare professionals have heard of it, and mental health is a key component of this model. We are also launching outreach and mobile services, not specialist ones. We want to make services closer to people, those people who, for whatever reason, don't have access to healthcare institutions. We are talking about comprehensive, all-encompassing healthcare services. It's all about basic healthcare that they should receive as part of primary health care, but mental health care is an important component there. So this is one big block. Since we had trained professionals and trained people, they were well versed in the body-mind medicine. They also completed multiple other trainings. They were trained in self-help techniques. So they were a useful asset that we had to tap into as well. Within our project, we are cooperating with some professional organizations in Ukraine, psychotherapeutic ones in the first place. These are the organizations that offer psychotherapy services. We're all used to living online, to working and living remotely. Upwards of 3,000 people, by dint of our support and the support of our partners, have access to all these services online. So these online services are quite effective, and this is something that we've heard from the users themselves, that they would like to be exposed to these services online. So we put together all these pieces, and we decided to create a space, a point of entry. You remember with Scheme, with multiple bubbles, so we wanted to continue growing and growing this space, this model, to have a more comprehensive and integrated system. We identified the key components of this space. First of all, it's a family doctor that received MHGAP training. It's one of the entry points. It's not the only entry point, it's just one of the entry points. When we are talking about this space and the services that should be provided, it's a combination of individual counseling sessions involving a psychologist, and we can also offer group activities, self-help plus or mind-body medicine, but there has to be access to community members through participation in group sessions, because it's not just skills training. I mean, self-help is not only about skills training, it's all about cohesion, it's about the unity among community members. So these are integral to this space of care for yourself. And since there's a wide variety of needs, it's also important to have online access. So basically, if there's a need for more specialist care, we can always refer to the relevant professional, like, for example, CBT therapists. So this idea was born. And finally, we have our first I Care for Myself space in Irpin community, Mikhailivka, Rubezhivka. You can see what the space looked like. This space was officially opened in July. It was visited by the First Lady of Ukraine and also Samantha Power, the USAID administrator, and it was a great impetus for all of us to continue developing and building this network. So, as of now, we intend to build this network of I Care for Myself spaces. So here you can see the regions of Ukraine where we are already present. We conducted this internal mapping for ourselves, and we used different symbols to denote different types of interventions that we already offer in this or that region. And we have already committed to building a network of such spaces. So basically, we want to create these spaces in different formats. Mikhailivka, Rubezhivka. This center is basically housed by an outpatient facility. This is a primary healthcare institution. There was a vacant facility there, and we transformed it into I Care for Myself space. We have some doctors working who completed the MHGAP training. They provide care to the extent possible. If necessary, they refer to a psychologist. A psychologist can offer group counseling sessions. The information about this space is disseminated within the community, so basically you don't really have to approach your doctor or psychologist to join group sessions. So sometimes you can be referred to a psychologist from a group session. But at the same time, we are mindful of the fact that the situation varies depending on the community. So such spaces don't have to be housed by healthcare institutions. It can be a social services center. It can be an employment center. It can be a facility of an NGO or a library building. It can be a space for veterans. It is contingent on the resources and needs available within a specific community. So our plan is as follows. We already have trained professionals in our pilot regions. We have already mapped all the services there. This is something that I alluded to at the beginning of my presentation. We have already conducted a needs assessment, so we have garnered feedback and inputs from the potential service users. The next step is as follows. We intend to conduct meetings in communities. This is something that we call co-creation. So we have the overall I care for myself concept, but we want to have it translated into the local context. You can show beautiful pictures, schemes, and charts. You can verbalize the model, but then the question arises, who will continue supporting it? How do we ensure the sustainability of this space? So from the get-go, together with our partners in local communities, we want to seek answers to these questions because we want to invest our resources into something that will continue operating once the project is over. On our part, we are ready to financially support the refurbishment of the facility itself. We are also ready to support with the elaboration of SOPs. We will lend a helping hand in terms of outreach and awareness raising because, I mean, it's important for people to know that, for example, in this library or in this space for veterans, you have some group sessions or individual counseling sessions. So we will definitely support and nurture the communication component. And once these spaces are established, we will also offer some additional training. We will also provide supervision support for professionals. Another important piece here is experience sharing. This is something that is crucial between our partners within Ukraine, within the same region, between different regions. Our project is being implemented by a large consortium, so we are also capable of offering some study tours to Europe and the US so that our professionals will be exposed to some first-hand, hands-on experience. But at the same time, I believe that the experience accumulated in Ukraine is so unique that shortly our partners will start coming here to be exposed to our model and experiences. Whatever we do will be meticulously documented. We will capture everything that works and everything that doesn't work because in the end, we want to have a model that will be effective and actionable. This is something that we call packaging. So it's not just about a random standalone project that did something. So there's the center. I want to open a similar center. What do I need to do? All the information will be publicly available, so we will describe everything in detail. We will also elaborate implementation manuals. And if there's a territorial community that has an avid interest in this model, they will have all the required resources at their fingertips to bring it to fruition. So these are our plans. Next year, we want to establish 10 spaces of this sort. And within the project, we want to open a total of 40 spaces like that. Thank you for your attention. Thank you, Alyona. You have provided us with a very insightful and instructive explanation of this model. I'm pretty much sure that a lot of the participants will approach you either later today or tomorrow. Friends, we are a little bit behind the schedule. I really hope that our subsequent speakers will stick to the time allocated. Our next speaker is Anna Didenko, the head of the Rehabilitation and Support Department of the Ukrainian Red Cross. The floor is yours. Thank you very much. Greetings, everyone. Well, you can continue greeting people. The presentation will be on the screen shortly. Good afternoon, everyone. My name is Anna Didenko. I've been working for the Ukrainian Red Cross for quite a while, since 2015. So I'm well postured to provide you with details on how our mental health and psychosocial support activities were shaped and molded and what the current state of play is. So we will be talking about community level support. For our organization, this is a topic that all our activities revolve around. So it's all about communities because we work on the ground. We operate in 200 local organizations. We are present in all the regions of Ukraine. All the activities conducted by the Ukrainian Red Cross are carried out by volunteers. If we're talking about psychosocial support, we have over 550 volunteers who provide direct support to all those who need it. On this slide, you can also see a wide array of activities that our organization engages in. We've been working in Ukraine since 2017, 2018. It's a large organization that not only implements projects, but we also place emphasis on building services for people who need them most. Briefly about our psychosocial support activities. Since the outbreak of the full-scale invasion, we have provided support for over 478,000 people in Ukraine. We supported them through evacuation. We also offered a multitude of psychosocial support activities and events for them. As I have already referenced, this work is nothing new for the Ukrainian Red Cross. Ukraine faced new challenges back in 2014, and we rose up to them from the get-go. And as most organizations, we started with our ongoing projects. But MHPSS cannot be grounded only in projects. We had to give thought to the entire system and to what it might look like in the future. So from a project-based approach in 2014, we started changing and transforming, and we started giving more thought to systematic services. The population faced enormous challenges and difficulties, especially since the eruption of the full-scale war in the area of mental health. I mean, these challenges are colossal. And if we want to secure these services on a regular basis, we have to think systematically. Since 2018, we've been developing a sustainable approach to these services in different regions. If we're talking about the MHPSS pyramid, we always have to transition from one level to another. So we have to start with basic services, basic psychosocial support services. Only then can we transition to more focused services. At later stages, we can add focused or specialized psychosocial support, psychological aid, and then we can refer to specialist services. Our activities were subjected to some changes in 2019 because we saw that there was a need for training in PFA, especially among the first line of contact professionals and emergency responders. During the COVID-19 pandemic, we implemented some online training in MHPSS because there was an acute need for that back then. What is our focus area right now? We are working on the basic level of this pyramid. We are conducting MHPSS activities. We are also offering training in PFA, but the needs are ever-changing. And if we have a look at the beginning of the emergency response, the eruption of the full-scale war, that was our primary focus area that we offered for the population. And now we can see that there is an increased need for more focused and targeted activities, especially for those people who will require more support in comparison with the past.
We started with the consultation and also with the alignment of the referrals for the patients or the clients. And this forum is a wonderful opportunity to merge or join in hands different organizations of NGOs and other public sector representatives of local authorities so that together they can create this system, effective system of referrals for the clients. Therefore, one organization cannot cover all of the needs. And possible as of now, is that a number of needs. The government also can't really answer to all of them, that there are organizations that provide help with that. And when it works in synergy, and when we are seeing in the rural locations, and it's so important to have this referral system and to work jointly on the provision of the services on mental health that are the most needed. And what else are we doing for the fact to move forward and to create the system that we are trying to integrate the basic psychosocial support, primary mental health support into the different areas of work. For example, it might look like when their medical mobile brigades are moving out into rural location, then the doctors, the nurses, maybe even the drivers that are taught in the primary mental health support, they are able to support and not only to consult them, but maybe during that they can use the skills of primary mental health support and to support to care for the basic services or needs for this person.
Чому ми працюємо?
Why are we working with the basic psychosocial support, and what does this give to us? First of all, maybe lots of people are familiar with that, but I'd just like to repeat myself, the fact that it's what we see in our line of work, that timely and quality provided basic psychosocial support allows to prevent the development of more complex issues with mental health in the future. And so also in case of a wide-scale emergencies or armed conflict, or the population, we will be able to have a bigger number of population that requires to receive such services. And physically, it's really hard to provide for all of the population with those services, if you're speaking about the specialized services. Also, during an emergency, and the biggest need of the basic services and primary mental health support and the expert line for the population takes too much time to the preparation of those volunteers, and that can take care of the mental health status. And from what we are seeing right now, simplest of things do matter. How you are having to talk with the person, like during an emergency, that you can join forces and unified families, get water to settle down with a person. They might help to deal with everything. And this is what is really working from our experience. This is those small things that are helping and that are helping to change something. So if we are to mention about the activities that we do in trying to implement them from psychosocial support based on the basics of levels, then first we do the skills, the creative, the art therapy, creative games, and we do the recreation activities, but there are specifics to all of those activities and basic psychosocial support is that they have an objective and what they are dedicated towards. And so our activities, they are dedicated to the fact also that the person is learning like how to deal with stress, and can be restored on the restoration of the feeling of safety, to calm the person, to renew the social connections. The fact that what we hear and that we see right now, one of the big needs that we have, that we are being informed both by parents that are also, our children are saying this is the complexity to adapt to the school, for example. Those are the people who are getting back from abroad. Those are the internally displaced people. Those are the people from the distant learning or remote learning trying to get back to schools, to the offline learning. It's hard for them. They don't understand like how to interact. How do you communicate? And this is a big issue that we are hearing about a lot and that we are informed a lot. And we see that those basic activities that the children and everything else, they are trying to learn how to communicate. They're learning how to support each other, and that they are not afraid of to try something new and to share their experience. And this is inspiring. And this is what we want to achieve with this activities. This is also about the fact that those small things are helping about the mental health and help to this community.
Окрім того, що ми
Apart from what we hear from our recipients, and this is the story that when the person was not able to speak during 4 events. This is the family that moved from Kharkiv, and usually they've seen events that it's really hard to, and so he started to speak during the 5th meeting when they did this the art therapy. And there's so many stories like that, but this is more so that not always you need to have something very specialized to help the person. And lots of us, so such a basic things can help and to support and to give resources to other person for dealing with the stress, and also for what other activities are trying to be aimed for. Basic support activities, they are about sustainability and resilience as well. And we all have those resources to deal with the stress. Sometimes people need this kind of support more or less. Somebody can deal with everything themselves, but the fact that what we see is this basic activity, they are helping this person to recover, to find this stability. The internal resources, that might be family resources that are supporting, and it can be used every time, and that can be helping. And as the result,
коли буде якась подібна
when there is a similar event in the future, they will know how to deal with that. Other volunteers that are moving out during occupation and during the fact when we have a full-scale invasion started, and they started to talk that my knowledge that I have previously from primary mental health support helped me to deal because I knew what I am to expect and what I can face with and how I can respond to that. And also, I would just like to say, during the influence of the basic activities and psychosocial support, there's always a complexity to show the effectiveness of basic activities, because activities are specialized and there's a specific algorithm, so how you measure what is the influence that they have. And also, it's really hard to say and measure like how do they influence and what kind of results they have. But we try to do that, and we did the questionnaire and survey among the service receivers, and what we see and what the parents are telling, that it was mentioned on the facilities or activities that done for the children. So we had a discussion with both parents, and we conducted more than 250 phone interviews, and the biggest number of our respondents, they've been reaching out to us to our facilities for or our activities for more than half of the year. And what we see is that during the feedback from the parents, those activities are aiding to the fact that children are increase their well-being, that those activities increase their feeling of safety, their capacity to deal with stressors, and also feeling of belonging, and to restore the hope that they harbor in their hearts. And those are the measurements that we're taking. This is what we were dedicating our activity on psychosocial support in the first place.
Звичайно, ця методологія потребує.
I beg your pardon. The last thing that I wanted to mention here is that we require possibly the further and future research, but this is the indicators that can show us how the basic line of support can actually help. Yeah, and thank you so much for your attention. Thank you so much. And I know that there's a lot of things that everybody wants to say, but the timing is, we are outside of our agenda for a lot, but well, we'll have less of a coffee. So I understand that everybody's tired, but I promise there's going to be 3 presentations in this block, so we have to force through. And I'd just like to invite the duo, Olena Doroshenko, the senior economist of World Bank in the Fund for Superior Health, together with Volodymyr Krostyev, coordinator of mental health and psychosocial support in Doctors of the World, or Medicos del Mundo Greece. Thank you so much, dear colleagues, and this is a great honor to be present here and to speak with all of you in the hallways and everywhere else, and to find the time to present about the line of work that we do. And from the name of the World Bank, from the partners in Ukraine, this is why we will try to do so shortly, and we understand that everybody is short in time. and we are outside of our agenda right now. But since there's a duo, then we are asking you for to be there with us for this time and to listen to what we have to say. I would just like to say a few words to what we did as a World Bank and the experience of the World Bank in Ukraine in the healthcare area. It was profound, and it was multidimensional. And mental health issue is one of the key components that we have. We've been working a lot on this topic starting from 2017, and as you're going to see on this slide that there have been many different implementation of many different initiatives there. And so we started from 2017 together with the International Medical Corps, and we did the full mental health assessment to understand where do we move, where do we go from there. In 2018 and 2019, together with the MDM Spain, Médicos del Mundo Spain, we worked in Donbass area regions so that we can help there to respond for the needs that are present there. And also with the Israeli Trauma Coalition to support the sustainability of the communities. We also have a few of the reports, and there is a few pilot projects that I would just like to shortly tell you. And the current projects that we are implementing all together with the MDM Greece, there's going to be an additional information as well. But what I would just like to mention here is that here on the slide, this is the big project that is helping us in Ukraine to implement activities as the response for the current situation, for war, and helping us to implement activities on the recovery of the health system. And one of the key components of this project that is being implemented by the Ministry of Health and National Health Service of Ukraine with the support of the World Bank and the partners that are providing both the credit and the grant resources. And one of the key components is the build-up of the mental health services in Ukraine. And therefore, for us, this is a really important, since we are providing funds to Ukraine, we really want to, for all those initiatives that are implemented in Ukraine, they would be sustainable and really so that Ukraine could share their own experience internationally with other countries so that this experience would be successful. On this slide, I would just really like to remind you that we think that those reports that we are producing, they are really important. And I think that everybody thinks so when they are making a report of any sort. But since those reports are lengthy and profound, goes into the line of work of mental health, and this is just one of those reports. Mental health and transition, and it's in Ukrainian translation as well. It's out from 2017, and one of the main recommendations of that report was on the integration of services in the primary care. The other report that we given in 2021, they've given detailed the expenditures in the healthcare system. Ukraine spends a lot, but they are speaking about the institutionalized care. But if we are looking at the accessibility of medicines and the patients and everything else that we are requesting and the medication and everything else, a lot of times patients are just buying this from their own pocket. And so that we have throughout the system of medications and everything else in this report, and this was one of the pushes, and we are so happy that for the moment
розвиватися і покривати ці ліки поки що обмеженого спектру, але все одно це дуже одна з поточних ініціатив, і також ми дуже дякуємо.
One of the current initiatives, and we are so grateful to NHSU that you were able to create this course, and that the person who had this course, and this helps how to respond and what to do during the speaking with the gender violence victims and others. This course is available, and this is one of the structural changes and to the preparation of medical employees to be able to document and to observe patients and to conduct in every area possible. Also, and we've started it a few days ago, I guess. And this course is that spreads out and gives you the primary assistance for the sexual harassment victims and others. Here, the font is really small, but I know that it's hard to tell all of that. But this is the only thing that I wanted to mention, that the pilot projects that we do are important for us, because from that we are just trying to read out like what are the needs and how to better organize support and assistance for them. Here we have 3 main pilots that we do. 2 out of them I already told, which is the Donetsk and Luhansk in the framework of the sustainability and readiness and resilience build-up, and this was a really needed line of work. And this is going to be needed even forward moving. We conducted a build-up of the system and organization of training, massive training, and also we have conducted a pilot in Zaporizhia Oblast, and so a lot of people probably known about it. This was the first efforts to integrate the primary care services and the primary care, and because of this pilot we understood that this is possible to do, and we are so grateful that in the future it became a mainstream. And also now, to tell you more about the current pilot, I would pass the floor to Volodymyr. Greetings, dear friends. My name is Volodymyr Korosty, and I'm a psychiatrist. And why am I speaking right now about mental health and the level of communities? Essentially, because on the beginning of the full-scale invasion, when every day, and probably the psychiatrists would agree with us, is that 24/7 we were trying to support our patients to move away and to not able to buy medication. And so we understood, and me personally understood, how fragile the system is of the mental health provision support. And when in Kharkiv, the specialists were trying to move out, and the load for the people who stayed increased 2-fold. And also in Chernivtsi, where internally displaced people came in a big amount, and also they increased 2-fold the workload on them. And when the person with the mental health disorder in a stress situation, she needs as much as possible and as never as before the support, or at least kind words and care. It was really hard to get this because everybody was overloaded, bared, and so without this background of the public health in there, it's just really hard to respond to the challenges of that sort. So that when we started to have this ability, with pleasure, I joined this pilot project on the services provision on mental health and psychosocial support in communities that was implemented by the MDM Greece, and was the initiative and support of the World Bank and the expertise in the psychosocial support matters. We have international expert, the Young, that has an experience of working in many countries in the world on all the 5 continents, essentially, in such situation connected with the challenges, technogenic or natural or after war. And so there was an interesting design created of this project that included in itself the work in 3 oblasts of Ukraine, which is Chernivtsi, Odessa, and Sumy. And we have conducted the research. There was the assessment or survey needs on HASPER that was translated scale to Ukrainian condition, and interview with the key informants and the focus group that allowed us to decide and define concrete individual needs of people that they need. And so what they need the help as of now. But the practical thing supposed to be presented, this is MHGAP. We don't need to follow this. This is not just the teacher of, we're not teaching psychiatrists, but just giving them the competencies that are helping them to discuss both with the people with mental health conditions and also helping them to treat the mental health issues, and also vice versa for people who are coming with mental health issues to help to point their attention to the mental health. And the methodology of issue management, and it's an important component because this is the methodology of psychosocial support of low efficiency that helps MHGAP, because those recommendations is the improvement of psychosocial support that the doctor and the medical nurse adds during the consultation, during the image gap process. It's really helping and improving on the problem management plus. And if we are to mention about the results, then in general, and they are really overlapping with what other partners are doing in MHGAP, and we are so grateful with the support and the implementation of other projects. And since the MDM Greece is a really new one, after the full-scale invasion and provision of humanitarian support outside of Ukraine, and this is the first project in mental health. But we already received the award from the European Parliament. Getting back to MHGAP, not everything, and it's not so bright as we would want it to be, independently of the fact that there is tremendous successes in the wide approval or uptake of this methodology. Almost all, in this short period of time of implementation of the pilot project, in 3 months, they have an increase in gross in number of people that are coming to the trainings. And by passing the training after they went through the online course. And this is in itself improves the perception and how they perceive the training itself and the quality of the training provided. And this is the wonderful step forward that they have an online course. And at the same time, we see that the people who went through online course, the specialists or the primary care and others, also have to do the training because they have the competencies, and it's important to move forward with the supervision and with the second portion of the modules that are not a part of the mandatory minimum that are being implemented. But there are organizations that are trying to do that, and they are spreading it out. And you can see this out of the results of the study. And there's another issue that's in some of the cases, there's no protected spaces for a doctor. In supervision, we see the 2 to 3 doctors, they are in the same room, and so it's really hard to provide care, and no matter what kind of competencies we would give to the patient in such conditions. So program management plus, management plus. And so we're grateful to the main implementer, MDM Spain, for the support and the implementation of this area of work. And so we included patients from people from medical areas of work, social protection as well, and also educational specialists. We were looking for options, like how can you provide in the simplest, in the shortest way to receive such care and support for those people. And this is working. And this is also important to continue to do so, to continue to do those consultation and supervisions as well. Methodology changes a bit, it's been modified, and so there are senior consultants that are helping with a group from 5 to 7 assistant consultants and to form those reports. And together with the group supervision online, this helps from one side the quality of the support of the supervision and helps to increase the load, decrease the load from the supervisors and consultants. The research in itself for the needs assessment and later on have been analyzed by us, and we were able to found the useful for everybody. It works in the public health and mental health model, essentially, that based on that experience has been formed. And the main objective in this is the creation of interaction network between the experts in different areas of work, the social work and the social support, so that we would understand like how in the conditions of the restricted resources, where do you direct them? And what are the experts, what are the competencies they're supposed to get for their interaction to be the most effective for our mental health, for our victory, and so that after victory we would be mentally ready after this traumatic experience. Thank you so much. Thank you so much for that. Thank you, and I am grateful to you to the victory that you mentioned, the victory and everything else. So we are out of our agenda, and so we have to continue in 5 minutes, but I do understand that this is on Rio, therefore let's continue in 10? Okay, in 10 minutes getting back. Okay, it's the most people had their coffee while you were sitting so that you will be able to take it. Okay, so 10 minutes and getting back, okay? Sounds good? And so we are starting not later than 4:30 for the panel discussion to start. Thank you.
Just a minute. I need to protract time a little bit. Maybe more people will trickle in. So some household issues. Can we have the QR code back on the screen?
Нам дуже важливо, щоб ви пройшли це опитування.
It's essential for us that you complete the survey. Only 5 questions. But I'm 100% positive that this is something that will help us enhance mental health cooperation and any other mental health related issues in Ukraine. Please scan the QR code. You still have 1 minute. You will definitely be able to complete it. We have some other QR codes. We will not really project them on the screen. It's all about signing up for tomorrow's workshops. By the way, you can see the QR code on your badges. You might remember some of the QR codes that we showed earlier. So if you haven't signed up for any workshops or sessions tomorrow and the day after tomorrow, you can do it using the QR code on your badge. So if you haven't done it yet, please do so. I really hope that you scanned this QR code. Well, you cannot really see the QR code on the smaller screens, but you can still see it on the larger screen. So we are ready to start the final block of our forum. It will not be as intensive, but not least important. So I suggest that we get the ball rolling. Well, I've been trying really hard to protract it for about 1 minute, and I can see that our numbers have doubled. Thank you very much. So we are ready to transition to the panel discussion entitled Coordination of Emergency Response in a Network of Mental Health Services. Well, I can see that a lot of you are busy completing the survey, but still, free your hands and clap your hands for our panelists. So I would like to invite up here Ms. Oksana Zbitneva, Head of the Coordination Center for Mental Health at the Cabinet of Ministers of Ukraine, Ms. Alisa Ladek-Brizhalova, Chair of the MHPSS Thematic Working Group Ukraine, hosted by WHO, Mr. Bernard Jacob, Federal Coordinator of Mental Health Care Reforms Belgium, and I also want to invite up here Renette van der Weiss, Coordinator of Humanitarian Policies and Mental Health and Psychosocial Support in Crises, Coordinator Ukraine for Stabilization and Humanitarian Aid Department, Ministry of Foreign Affairs, the Netherlands. Greetings, and it's a great pleasure of mine to give the floor to the moderator of this panel discussion, Ms. Hanna Fahmy, co-chair of the Interagency Standing Committee MHPSS Reference Group hosted by WHO headquarters.
Long day, but very rich day. I learned a lot today. And I look forward together with you to this exciting topic, coordination. There is a lot happening in Ukraine regarding mental health and psychosocial support coordination. When we talk about the field of mental health and psychosocial support, coordination needs to be across sectors because the field is multi-sectoral. Means that usually, in good practice, there are activities for mental health and psychosocial support happening within health, within education, within protection, within nutrition, within various sectors and various ministers. Whether the situation is humanitarian or development, the coordination of this area is multi-sector. That come with challenges, come also with opportunities. In my day-to-day job, I'm asked to support coordination group with focus on humanitarian settings. I visited Ukraine a lot, and I visited other countries as well, within humanitarian context and within development context. And this is the story of this session. Ukraine, uniquely, is having the world's largest mental health and psychosocial support coordination group. 300 actors. Not only the world's largest, it's the biggest in history of mental health and psychosocial support. This is the largest mental health coordination group. Alisa, you are leading the world's biggest mental health and psychosocial support coordination group. Tell us about its history, how it was founded, and how do you manage it?
Дякую, Фамі.
Thank you very much, Fahmy. The group was established in 2015. I can see a lot of familiar faces here. I'm pretty much sure that most of you are familiar with the story. And it was set up as our response to the humanitarian crisis in Donetsk and Luhansk Oblast in the first place. And Back then, we had about 50 partners. All of them operated within these two oblasts. And interaction with the public sector would take place only on the level of these two regions and the authorities of these two regions. The group was established under the umbrella of the UN coordination system, and it was also established under the umbrella of the healthcare cluster. And by the way, there were certain activities unraveling before I joined the team. So the group started forging links with the protection cluster, children's protection subcluster, also GBV subcluster, and whatnot. The coordination group did everything within their capacity from the get-go to ensure this multi-sectoral approach that you, Fami, referred to. Over the past 8 years, we have a new generation of MHPSS. So over the past 8 years, we've been able to cultivate an entire generation and community of MHPSS. Nowadays, in Ukraine, we have a multitude of seasoned professionals. These are people who are well-versed in this area. And we also have a large number of professionals with Ukrainian experience working globally. And over this time, we have also elaborated a portfolio of MHPSS interventions. We call it a portfolio. So we have a wide array of tools, manuals, textbooks. You can find them in the hallway. There are some books and documents there, so please approach them, have a look at them. So we have people, we have professionals, we have expertise, we have a community, and we have tools at our disposal. So all these components and the entire MHPSS platform have been very useful and beneficial. Well, we thought that we were not really prepping for anything. We were just responding to this humanitarian crisis. But then 8 years, solid preparation, translations, training, all this laid down a robust foundation to help us prepare for the challenges that we faced in 2022. So as Fami alluded to, we have upwards of 300 actors as part of the coordination system. We are very delighted that we have this powerful force at our disposal, that it's a robust community of professionals. And side by side with the Coordination Center for Mental Health, we are working together with our partners. We are having multiple discussions, dialogues. There's a lot of planning involved. We want to make sure that our humanitarian response takes into account and reflects the needs of the system. Each and every step that we make, each and every investment that we make as part of our humanitarian response should contribute to the development and growth of mental health system and services. We are happy that the National Coordination Center joined this initiative, and the government is at the helm of this process. Right now, we are in close cooperation with the public sector at national level. Our shared purpose is as follows, and this is something that you will hear more about from Oksana. We want to make sure that both the public and non-public sectors move side by side as part of humanitarian response and service development.
Basically did one of the key ISC principles, which is building on existing resources. You didn't establish a new system completely, but you built on the technical working groups that pre-existed before the war and established sub-national groups and technical working groups. In fact, Ukraine now, at sub-national level, have some of the world's best MHPSS technical working group coordinators, either from here in Kiev or in Odessa or in Lviv or many other oblasts. Oksana, you are leading a pioneering initiative, National Mental Health Center. Can you explain to our audience why the National Mental Health Center exists, what its function, and what its future looks like?
Дякую.
Thank you very much, Fami. Thank you, colleagues. My gratitude also goes to Alisa. On the screen behind us, you can see a very complex and convoluted scheme. By the way, Alisa and I did everything possible to make it as simple as possible. So this is a scheme or diagram of interaction. In fact, governmental partners and NGOs can do a lot. But first and foremost, it has to be part of the public policy agenda. Otherwise, there will be no fruits. That's why we do not have a split here into the public and non-public sector. We need to work together. The coordination system that we are trying to build and forge has been borrowed by us from Belgium. Bernard, thank you very much for revealing all these secrets to us, but I think we have improved your system. So how does it work in practice? Within each and every line ministry, we have a deputy minister responsible for mental health. In each regional military administration, we have deputy governor in charge of mental health issues. Each regional military administration hosts a coordination center for the support of the civilian population. So basically, this is a mirror of the Interagency Coordination Council, chaired by the Vice Prime Minister and Minister of Health of Ukraine. So this is the vertical or the chain of command that we have in place, and it allows us to unite and bring together resources, and it helps us be effective. There are several key messages that I would like to communicate to you. Coordination is about relationships in the first place. It's also about your passion and love for whatever you do. And coordination is also a sort of magic. I would like to share one story that will definitely mesmerize you. There are two deputy governors present here, and on the 3rd of May, they made it to one of our trainings on the topic of mental health. 2 weeks ago, they met at this training. They're just counterparts from different oblasts, Vinnytsia, Poltava. 2 weeks ago, they got married. Alexei, Natalia, please rise to your feet. I wish you all the best. I wish you all successes. And I really hope that your mental health will be as solid as rock. Thank you very much. Each regional coordination center has a regional coordinator for mental health. Please raise your hands. If we have some regional mental health coordinators, raise your hands. Yeah, I can see that you bunched together. Everything that we do together. Why? Because we want to create this web. We want to engage in networking. And today, I would like to call upon all the international partners present here, all the representatives of NGOs, to do something. I mean, if we want to be effective, if we want to serve in the capacity of a resource for one another, coordinate whatever you do. It doesn't really matter what you engage in. It doesn't really matter what you are implementing in the regions. Be in contact with the relevant deputies of regional governors. Touch base with our regional mental health coordinators, because they are highly aware and mindful customers. So they will let you know where to go, what the needs are, which needs are not satisfied for what target resources. We cannot really afford to spread our resources thin. We have to do everything within our capacity so that the services created stay in Ukraine for the long term. Even when the donors are not here, even when the donors pull the plug on finances. This is a great challenge for all of us. So forge relationships, nurture relationships, and coordination is about trust in the first place, the most valuable currency globally. Thank you.
And I think Ukraine is not making a surprise here. Ukraine is making history again, as usual. Because in the operational roadmap, we plan that the long-term vision is to establish oblast-level coordination mechanism. The idea that this would happen 2 to 5 years from now. I think Ukraine has achieved that only 1 year after the date the operational map was achieved. Really, before the time, at least 3 years before the time the planners were planning to achieve it. You are moving fast, but you are learning as you go, and we as well with you. I'd like to move to Bernard, and I'm really glad, Bernard, that you are here with us, and colleagues from Ukraine has visited Belgium to learn from the network of mental health services. This is not a humanitarian context, but colleagues came back with a feedback that they learned a lot. Can you share this experience with the audience, and how is the network of services in Belgium is like?
Thank you. Yes, it was really a very interesting week. We had to share our different experience, and Sana, it's a changing of culture, and it will take time. I think we need time to change the model. During this week, we have tried to show that our model follows an integrated and global approach, a policy who incorporates all relevant domains and coordinated action. Global means, for me, all included, complete. Work on all different aspects of the mental health team, and it requires an integrated approach. Integrated means involvement of all relevant actors, services, and sectors. It's an horizontal approach and a vertical approach among all competence levels. All sectors in the context of mental health care are defined and have been placed in an integrated model. Of course, in a community mental health model, it was essential to involve other players, such as those from education, culture, leisure, justice, training, and employment. You know, in Belgium, we have 7 different ministers of health. It's a little country, but very complicated, and it was really a challenge. But we need the support from the authority if we want to have success. It's a support for the people who are working in this area. The current organization of mental health service should gradually make way for a network of alternative service within a defined area. This means that each of resource must be adapted in order to become a complementarity totality. For each sector, a model should be developed with the creativity and originality of the actors. It's not a bottom-up model. It's a bottom-up model. It's a top-down model. It's not a bottom-up model. It's very important. Moreover, the overall philosophy of the model should particularly be taken into account. We have stressed that this fundamental sector implies a form of care where all actors have to work together at different levels. For me, after 15 years working in this area and to be the users and family representative and the collectivity. It's really important to point out that we have created a new function named Network Coordinator. It's very important for us. It's a very interesting job. It's a central job from our success. The Network Coordinator is chosen for a specific area. Our coordinators were elected by the authorities. It was a very important job based on a specific profile. The network coordinator takes note of the current resources in the area of his network. He adopts the profile of facilitator for the creation of a network. He is familiar with the specific characteristic of the various resources, with the progress of the action. He is meeting the responsible person and bodies. He makes a mapping of the network. To conclude, because it's very difficult to speak about 15 years exercise of networking, I would like to say that before, individual organizations would competitively lobby for resources. Now, we don't pay any more individual resources. We pay the network. and the network must organize himself the different resources. It's very difficult. It's a changing of culture. Before, objectives were free of choice and more competitive. Now, all actors are challenged to develop complementarity objectives. Before, organizations chose their in- and exclusion criteria. Now, no patient should slip through the crack. Before, actors could freely develop exclusive collaboration, but now it's essential that actors collaborate intersectorial and integral. It's not a pilot project in Belgium. It's a reorganization of all the system for all the country, and we are proud after 15 years that we can slowly, step by step, define a new model.
Bernard, thank you. Great insights. And I think there is lots of wisdom in what you are sharing. And for someone working in the humanitarian field, I think one of my take-home messages also from your excellent insights is about avoiding individual competitiveness among stakeholders and looking for collective impact. That's a great take-home message among many you have kindly shared with us. I want to move to Renette. Renette, the Netherlands is known as a leader in global advocacy in the field of mental health and psychosocial support in emergencies. Can you share with us your reflections as an MHPSS coordinator and as a donor? Why would you like to invest and invite donors to invest in the operational roadmap in Ukraine, including its coordination model?
Thank you so much, Fami. And thank you all. I'm humbled to be able to speak here and to speak as a generalist. I'm a diplomat. I'm not an expert, but I've joined the work that the Netherlands did over the past years to try to push for integration of mental health and psychosocial support into emergency response, any type of emergency response from the very start. Because if it's not there from the very start, you have to then put so much efforts in getting it back into the efforts later. But it also means that I'm coming to this discussion from the emergency side, from the crisis response side. What we saw, even after 2014, but definitely after the full-scale invasion last year, an enormous amount, big growth in needs, understandably, but also an enormous growth in initiatives. Very, very impressive initiatives, but also very many of them. And I think quite quickly we started to get a little bit worried about however will Ukrainian society, let's say, deal with that, with all those many initiatives scattered sometimes, and how to ensure quality, how to ensure that they reinforce each other and do not compete for results or maybe for funds. How to ensure that sustainability is built into those efforts, and also how to achieve scale, because scale is what is needed because of the scale of the needs. Over the past years, we've been working very much with the Interagency Standing Committee, MHPSS reference group, which has developed so many materials also on the coordination of efforts for MHPSS in emergency settings, because in those humanitarian settings, it also became clear that if organizations do not work together and divide labor, that then they can actually inadvertently work against each other. So it's one of the lessons that comes from emergencies and from the work on MHPSS in emergencies, that coordination is so important, and that indeed, I fully agree, that donors and international organizations need to be called to work together and to ensure that they do not all do their separate things. And of course, they need to tap into local available capacities, expertise, knowledge, experience. Things need to be contextualized. Everything has already been said today. I'm only repeating what you told earlier today. We have the Netherlands has supported over the past years a mechanism through which experts from many nationalities could be sent out, a rapid deployment mechanism, to help the coordination of MHPSS efforts early in crisis especially, to get that well organized among different humanitarian organizations. And for example, a number of those experts also were quickly deployed to neighboring countries immediately in the beginning of 2022, when many Ukrainians had to leave this country. There's another level of coordination which is needed, and which is the coordination away from not only the humanitarian field to also other international and local actors probably, but definitely international actors, those that work on this, for example, under the framework of humanitarian demining and rehabilitation. There's MHPSS involved there as well. There are those that are working, that are coming in more through the entry point of conflict settlement and work in that field. And often these are different professional communities that don't even use the same words and the same terminology. So that kind of coordination is needed as well. And definitely, again, where possible and where available, it's so important that this coordination happens together with national systems and with national authorities. And that is so important, as you also said, for sustainability, for scale, and also for the issue, very often, it depends on the setting, but for the possibilities to refer, because you cannot work at the most basic, maybe low-intensity level of psychosocial support if you have not also thought about how to refer people that need more support or more specialized support. I'm nearly finished, Fanny. I just think that one last and maybe the most important reason, and I think Ukraine is giving a very, very impressive example of that, is that you cannot only work on addressing immediate needs. You need to think about the system through and inside which you do that. You need to also think about necessary changes to that system. So how to already work not only on immediate needs, but also on early recovery, on the building back better, as it is called. So there are many reasons to support Ukraine through the Ukrainian efforts to bring all those players together, and do bring us donors together as well. Please do. Thank you.
Thank you, Renette. Thank you so much. Renette, you kindly mentioned the deployment of coordinators through the surge or rapid deployment mechanism to the Ukrainian refugee receiving countries. That was really timely and very effective. And actually the establishment of MHPSS Technical Working Group coordination mechanism in neighboring and affected countries from Poland to Slovakia to Bulgaria to even the Baltic countries also as well, Lithuania, Estonia, and has really influenced the response and facilitated knowledge exchange through the coordination mechanism in Ukraine with other countries. I remember Elisa's presentation in one of the neighboring countries was introducing the MHGAP model and how Ukraine has implemented this model with our colleagues in European Office of WHO facilitating this process of knowledge exchange. Elisa, there were many successes in the last 600 days. It's against all odds to talk in very difficult times like these times about successes and establishment and achievements, and not building back better after the emergency, building while emergency is ongoing and happening. But I want to ask you a question about difficult moments and challenges of coordination. Were there in these 600 days any difficult moments in coordination, and how did you deal with them?
Thank you very much, Fami. I would like to start by saying that back in February 2022, the greatest challenge that all the group partners faced was to repurpose their activities and reformat their activities within a tight framework. Because before the full-scale war, we operated only in 2 oblasts, and then overnight we had to scale up to all the regions of Ukraine because we didn't have a single safe place in Ukraine where people would not need MHPSS. Another challenge was as follows. The community and the professionals that I alluded to earlier were also representatives of the civilian population affected by the war, and we also required support. So basically, there was dual strain on our shoulders. We had to take care of ourselves, to withstand, to persevere, but at the same time, we could not afford to interrupt. On the opposite, we had to expand and scale up our support for the population. I think that we coped very well. I would like to illustrate one example. In early March 2022, our partners and I scheduled a meeting, and we decided not to cancel it. We had a lot of hesitations and doubts about who would be able to participate. As you might remember, in March last year, everyone was on the move. The situation was very dynamic and fluid. A lot of people were in the process of relocating. They wanted to move to a safer place. Some people were already in other countries. There were a lot of people spending days and nights in bomb shelters. But against all odds, we decided not to cancel this online meeting. To our consternation and surprise, a lot of partners, a lot of the people present here joined. I have this meeting indelibly imprinted in my mind. I cannot really say that we did a lot of strategizing back then because everyone was in shock state. There were a lot of pauses, uncertainty. There was this really weird spirit floating in the air. But most importantly, we could tangibly and viscerally feel this spirit of unity. We spent some minutes of silence together, and even during pauses, we just tried to come to terms with what was happening and what to do next. Following this meeting, everyone recovered and reeled after initial shock. Over time, we successfully completed this process of repurposing, reformatting, reprogramming, scaling up, and whatnot. Our numbers started swelling up. We were inundated with calls and requests. New partners joined our group. Those were people who worked for various organizations, hospitals, mental health institutions from different corners globally. These were either ordinary people or organizations. It was a diverse bunch of stakeholders, believe me. We also had some people from universities. We had partners with the experience of development initiatives, but they didn't really have any experience whatsoever with humanitarian response. And we also had partners from humanitarian response, but without any experience of working in Ukraine. So my point here is that it was a diverse group indeed, and the challenge was to make sure that we were on the same page.
And here I think it's a wonderful initiative of the First Lady working in the All-Ukrainian program and the development and establishment of this center. Because at this stage, we have consolidated our efforts, our vision, our mission that I demonstrate by this slide. And this was a decision of that we were able to discuss and start discussing, I think, in March of last year, but implemented only.
Story of resilience. Not only the system you are building, not only the figures we saw for services such image gap today, this morning, but actually the fact that you developed an operational roadmap to strengthen the system that was being circulated for feedback only a few weeks after the start of the war. That's a story of resilience that many countries will learn about for other responses in the future. Oksana, I met your brilliant oblast level indicators last week. I was privileged to spend with many of them 3 days in capacity building program. I want to check with you how your colleagues, how the oblast level coordinators, how the mental health coordination office interact with new actors who are not familiar with mental health at oblast level. Meaning health sector and social sector usually are familiar with mental health and psychosocial support. How do you interact with other actors? What advocacy do you use to make sure they are included in oblast level coordination mechanism?
Thank you so much for your question. And so that you set me for 3 minutes, but as I looked forward, that maybe my colleagues would reinstate it. Maybe I will not be able to answer all of that in 3 minutes, because this we're supposed to mention, and this is supposed to be discussed as well, not just talked about this. And so I will make an example when we just started to do this coordination center for mental health to the cabinet ministers of Ukraine, and it's in existence for only 7 months. So thank you so much, everybody, for the support. We are a newborn baby, and so you can assess that for a small period of time, really, we were able to build something that is a fundamental thing, or the pillars on how everything else will unravel and build upon. Today, Ihor mentioned one of the key things that the family doctor needs to know about all of the other services that are working in the community, even in the small village. And by having this in an objective, we need to build our steps to build the process on how this has to happen, who has to do this. Every provider has to know about one another. Family doctor needs to know, as both as the family workers, about all the support groups, about all the unofficial services, and somebody has to build the route of the referrals. We are not just speaking about the specialized care. This is your networks. And by understanding that the end objective, which is the networks of services and awareness of one another, this is why we started to build this process. I would just like to tell you, when we started to have our first or the biggest challenges, this was to spread out or increase the awareness or understanding of the mental health. This is not just healthcare. And at the first meetings that we were collecting and we were gathering, in the first groups of people that we were gathering with the oblast as well, at those places we were sent in the best way forward, the health department, and even in the best way, just the head psychiatrist of the oblast. And what we needed to do is that we are building this system where there is all of the sectors covered, where these components of mental health have to be in every area possible. Social area, safety and security, education, science, sport and economy, business and scientists, and higher educational facilities, and not only medical ones. And so when you understand what is the ecosystem from top, how do you see this, and so how to move this up to the community, and so then you understand how many steps you need to do up, down, and in other directions. And so this objective that we can do. So my idea is in the following. I think by understanding the consequences of all of those events that Ukraine has went through, and all of those experience that was taking in, and the objective that we are trying to see and help with post-traumatic development, right now we need to be really honest with all of the partners on all of the levels, that to respond, we need to do the systematic steps and those sustainable services that was mentioned a lot about. And so this is an important thing, and I see Fami, and I know this. This is why those activities and those dialogues about the facts that the needs are that have to be covered by the service, and the service has to be covered and it has to be integrated. And so when the international partners are coming in, and I would just like to tell you that we know of that what we are building. First of all, we know what the priorities are, and today all of the 11 ministries has priority projects in mental health. And this is important. We know where do we have to attach our help, and so please do talk with us. Thank you so much.
It's amazing, Oksana. I think this model you are creating, the architecture you are creating here for coordination, is basically a prototype that will be used in the future as a model for humanitarian development nexus in MHPSS coordination. It's a great model for Ukraine and for many countries to learn from. Thanks for your leadership on this. Bernard, I'm conscious about the time, so I ask you kindly, you and Rinette, to have 3 minutes only in your response. And my question to you about engaging service users in the network. How people with lived experience engaged with the network of service you have, and what's the role?
It's very quick. Participation of users and their family has been a priority in our approach since the beginning from our reforms in 2010. And this is true at every level of the organization. One of the reasons for this is that we focus on our work on the needs of users and the family, and their opinion are very important. At different level, and micro level for individual providers, at meso level for care networks, and macro level for authorities, very important. And there are challenges, of course. It is a major culture change that requires time, both for the users themselves, but also for the professionals. It implies a change of culture, practice, and perception of mental health. And it requires professionals to recognize users as stakeholders also. Training for everyone, cross-training, is also very important. It's a priority for us. And participation of users, of course, is a beginning of the recovery. In conclusion, we need to support the creation of environments that encourage user involvement and promote good practice in this field.
Thank you, Bernard. Thank you so much. Indeed, nothing about us without us. Sadly, we see commonly the pitfall, everything about us without us. But thank you for sharing with us your insights about that. Rinette, as a donor, would you sometimes get projects that you would never fund? And can you share with us some insights, what these projects look like, so we learn, all of us, not to write this type of proposals?
Maybe I should start, first of all, that really the Netherlands, we're trying to push for integrated policies. So we're trying to push for everyone, international organizations, other donors, to include MHPSS in their strategies, to have an MHPSS expert involved when a needs assessment is going to be made, so that in order for an appeal to be MHPSS inclusive. The Netherlands is supporting humanitarian partners in an unearmarked way. So we do not take in proposals for funding because we say we work through those humanitarian partners, also through other types, mine action partners, for example. But of course, given this discussion, I think there are a couple of things which are really important, and that is purely standalone activities I would be very doubtful about. I think the need to be linked up to the networks, to what's out there, what's available, that is one aspect. Another aspect is whether actually the proposal addresses true needs and not if I may call it like that, invented needs or generalized needs that in other circumstances may be needs, but maybe not here. If there's no clear reference to not without us, about us, so to the involvement of people with lived experience, that would definitely, I would have doubts about that. I think that, but I think that the linking up to others that work in the same field, the division of labor also with others, so that the one can work more with children and the other is more experienced in working with other population groups. Do that because that synergy is needed, otherwise we will never meet all those needs. And I do very much trust that if you link up with the coordination center, with the networks available, that then also the coordinating system will facilitate and stimulate and enable private initiatives, because I think that also is very important, the space for private initiatives to also thrive if they live up to these kind of criteria. What we try to do is to create the global space, the space that you all need to do your work and to receive MHPSS inclusive funding and to receive MHPSS inclusive mandates, because then we can, from our role, we can achieve more than if we were to finance one or two projects. Thank you.
Thank you so much. It's important to mention that the operational roadmap for prioritized multi-sectoral mental health and psychosocial support actions during and after the war in Ukraine is actually developed based on international standards, including the IASC guidance, particularly the minimum service package that was funded by the Netherlands and currently also funding its implementation and rollout in many countries. I heard one of the cluster coordinators once said, mental health and psychosocial support is like a litmus test for the whole humanitarian system. If the coordination in this area is working, you usually can identify if coordination in general in the humanitarian system across various sectors is working. I think this is true, and I think Ukraine was what we heard also from our distinguished speaker, and we learned also from models in other countries about context for coordination, and the great work is happening in Ukraine and continuing. I think Ukraine is becoming really a great model for the rest of the world, the continuance of the work in Ukraine and for the rest of the world as well. I thank our distinguished speaker and thank all of you for listening to us. Thank you.
And we are grateful to you for this discussion. Thank you so much. We can give another round of applause for everybody who worked on us in this scene. Thank you. Ladies and gentlemen, we are almost at the finishing line. We have just two solo presentations, and if we are to mention figuratively, then today, during the whole day today, we have reported a lot. So we mentioned what we did already, and we mentioned what is happening right now and what we can do in the nearest time, in the nearest future. And now maybe we can have a deeper look into the future, into the most highest perspective into the future. And so about that, we will be speaking right now. I'd just like to announce a presentation that's called The Future of Mental Health in Ukraine. This is a scientific vision on the not scientific language from the representatives of the Lancet Commission. And so under your uploads, I'd just like to include Irina Pinchuk, the director of the Psychiatric Institution of Kyiv University, named after Taras Shevchenko, vice president of Association of Psychiatrists in Ukraine. And so I welcome you to the floor. Thank you so much, dearest friends, dearest colleagues. And I know that I was asked to speak with now the scientific language and with a simple words, simple terms. And I do understand that in the ending of the interesting but emotional day. And so I will be trying to speak as short as possible or as brief as possible. So I will be like to speak about the unique chance that we have for Ukraine, and this chance the Lancet Commission on the mental health and research in Ukraine is doing. I'd just like to explain two words: the Commission and the Lancet. What is the meaning for the mental health in general? So I think that many of you know that Lancet is the British popular and referred journal, and so this was founded in 1828 by the British surgeon, and this is why he got this name from the name of the surgical instrument of Lancet. And so this Lancet Psychiatry is one of the 24 journals from the family of Lancet, and so in this year it has 200 years in the making, and this is a strong, most authoritative journal, and many scientists, almost everybody, dream of having a publication in this journal. This journal is publishing not only scientific papers, and also we can reach out with the personal opinion, with different clinical cases, original studies, and so I can say that even my personal experience at the beginning of war in March of 2022, I had the letter to the president of Psychiatric Association and to remove the Russian Association and ask them to print this letter into the letter of Lancet Psychiatry. And so it was published there, and so you can also work there as well. So what's concerning the commission of this is not like a check for somebody or something else. This is the procurement from the editor of Lancet Psychiatry of the cooperation with the scientist and to have these issues on mental health, to provide recommendations that will be influencing on the health policy, also on mental health policy, and also on the improvement of the practices. And in general, there are some algorithms and some rules on how this strategy can be done. This is a specific and special scientific paper that can be signed by the group of experts, and up to 25 experts are really in the consultation board, and there are leadership of this group, and they are sometimes working for 2 and more years, and the amount of this work is under 10,000 words. I would just like to show you an example of the last of the latest commission of licensed Lancet Psychiatry. This article has been published in March 2022 on violence and mental health. Now, during coffee break, we mentioned a lot about the commission of Lancet, the general journal that was publishing the article in the end of last year about this stigma, and right now the discussion starts a lot about this scientific paper. Regarding our commission and of Lancet Psychiatry, that what we have is the working name, The Future of Mental Health in Ukraine, the Vision of Changes. And as of now, at this moment, this scientific paper formed like the authorship group, and there's 41 experts are working from 14 countries of the world, representatives of different organizations, and we have the representative of our coordination center there as well, under Cabinet of Ministers of Ukraine, and the coordinators of or representatives of the WHO, the elect president of the World Psychiatric Association, the president of the European Psychiatric Association, the experts, scientists, and from different parts of the world. Those are not just psychiatrists and people of completely different specialties. And the main objective of this article is to do the strategic scientific paper on the future of mental health in Ukraine. This article we were planning to decide upon as a status as of now in Ukraine, what is happening, and to decide on the goal, where are we trying to achieve as a country, and to decide upon the issues and the gaps as well that would be recommended to be solved in Ukraine so that we can reach to the objective that will be decided upon in this article. What I can mention here is that the organization, we have 27 people that are working in 5 areas of work. We are also taking upon ourselves the coordination as the background and coordination in the areas which is clinical and practical services. Those are the scientific research, training and education, advocacy and rights, and 27 experts separated to 5 to 7 groups, and they are working in those groups. And we have the consultation board to which we are trying to refer to and asking to look at everything that we worked in to give us the recommendations. And so shortly, as of now, we had 2 meetings done. And first of all, the Lancet editor of psychiatry proposed to us to write this article on 24th of February of 2023, and when the Association of Psychiatrists of Ukraine had conducted another World Congress, and this was like a date and meaningful for us, and so we have formed this group and from June they started to work. Their first meeting, and it happened to be in San Francisco, and during the work of the American Psychiatric Association, and so in September this year, and there has been a second meeting, offline and online, and as of now, we already have 5. In this 5 area of work, we have 5 documents on the subgroups, and we are planning in March, beg your pardon, in November, to join all the data that has been worked on by our colleagues. And we placed an objective then on 25th of November of 2023. We will send this article into the journal. And so we know that all the articles are passing for 3 to 4 months. And so I think that in June next year it will be published. And so then we will be able to discuss all of those details and everything else based on the results on those things. We can just provide the information, and we can't really discuss on all of those data that we have as of now. We have international materials from the WHO and the Coordination Center and all of our experts in Ukraine. Everything is there, and so a strong potential of the scientific database in the world. Therefore, this is the line of information just so that you know what we're working for and how. And I don't know the country that would have such a chance to, with the name of mental health and other things in the country. So I think that this document would be an example for other countries to be processed and to work on their models. Thank you so much for your attention. Thank you so much, Irina, first of all, and for the timing as well. Thank you so much.
Я сподіваюся, що і зараз буде так само, тому що зараз ми будемо з вами
At this time, we will be the wonderful presentation experts that is the science for the investments into the mental health. And so I would just like to invite our guest, our expert, James Salem, the Director on the Policy and Advocacy in the organization United for Global Mental Health. Please welcome.
A clicker. Thank you very much. Good afternoon, everyone. I am fully aware that I'm the last person to present today, so I will keep this quick. It's a pleasure to be here. It's such an honor to be here in Kyiv with you. My name is James. I'm the Director of Policy, Advocacy and Financing at United for Global Mental Health. We're an advocacy organization campaigning for more investment financially and politically in mental health across the world. And I'm going to talk to you today about financing and the global landscape when it comes to financing for mental health. So sort of zooming out of Ukraine for the moment to have that context about what's happening around the world. We recently released a report, if I can get it to work. There we go. We recently released a report where we looked at domestic financing, so what governments are spending on their own citizens around the world. We used the WHO Mental Health Atlas data for this, and we compared it to the 2018 Lancet Commission, actually, the Lancet Commission on Mental Health and Sustainable Development, with their recommendations of what governments should be spending on mental health, which is 5% of domestic health budgets for low and middle-income countries and 10% for high-income countries. And what we could see is that using that, and here you can see the bars below the line are countries that are off target, and there's countries above the line are the countries that are exceeding those recommendations. The darker bars are for high-income countries going through to lighter bars for low-income countries. And we can see that the vast majority of countries are not quite meeting these targets yet. And we calculated that this is accumulating to a $200 billion annual financing gap for mental health around the world. We also looked at external mental health financing, so development assistance for mental health, aid for mental health around the world. We used OECD DAC data and IHME data for this. Our assumption is that there's under-reporting here from donors when they are coding what projects and investments are spent on mental health. Sometimes they'll be coded under what the primary goal is for that project and maybe not including mental health. However, going on that data that has been reported, we can see that there's generally been an increase in mental health development assistance. However, we did see a sharp drop from a high of $300 million per year down to $200 million a year. Our assumption is that is due to shifting from the COVID pandemic, but also a squeezing of aid budgets around the world in general. And so it's important that we are consistently advocating, campaigning to donors around the world to be prioritizing mental health and how they invest aid around the world. And just that last point is that actually we saw about half, if not just over half of money going to mental health around the world. External finance is coming from private or philanthropic sources compared to bilateral or multilateral funding. So I was asked to talk about evidence for mental health investment. And so what I'm going to do is I'm going to give you 3 arguments, which I'm sure you're well aware of. I feel like I'm preaching to the choir a little bit here. But we're going to talk about investing in mental health for physical health, for mental health, and for economies. So investing in mental health for physical health. And here I want to use the example of tuberculosis. We know there's a strong bidirectional relationship between TB and mental health. There's huge overlap in vulnerable population groups. And so we wanted to see, okay, so what would be the impact if we integrated mental health services into TB programming around the world? If that's where we put investment, what would be the outcome of that? So we did the modeling using UNAIDS data on TB and a number of studies that have been done on the impact of mental health integration into TB programming, and we saw that the impact could be huge. So this was done 2 years ago, so between 2021 and 2030, potentially 14 million cases of TB around the world could be avoided. What does that look like in terms of infection rate or case rates? We can see that we can bend the curve. We can make a significant positive impact on TB case rates around the world, or incident rates. And then when we looked at what total case numbers would, how that would be affected, we could see that, mostly due to population increase, we're struggling to see a significant decrease in TB cases, total TB cases between now and the end of the decade. But if we integrate mental health services into TB programming, we can see a significant decrease. And in fact, the accumulative total of that difference is greater than any year projections for total TB cases. We're talking really large figures here when we're thinking about investing in mental health for physical health outcomes. And then investing in mental health for mental health outcomes. We wanted to look at what investments would have, what the impact of investing on service coverage rates on mental health outcomes. So we took the WHO Comprehensive Mental Health Action Plan target of increasing service coverage rates by half. And I should say that this was looking at 5 mental health conditions, these being anxiety, bipolar disorders, depression, epilepsy, and psychosis. And we can see that even with modest gains in service coverage rates, we can see significant gains in mental health outcomes. And we took that further to look at service coverage rates of sort of half and then up to 80%. And I know health economists in the room will probably want to speak to me afterwards about saying 90% plus coverage rates, but we wanted to really stretch this and see what the potential outcomes could be. 90% plus for some of these service coverage rates has been achieved. And then we looked at this for 2050 as well, and we can really see some staggering figures. So when we're talking about investment and when we're talking to finance ministries about why we should be investing in mental health, we can push that it's not just physical health outcomes, it's also mental health outcomes, and we can talk about some really large statistics that are possible. And then investing in mental health for economies, for countries, for societies, and economics. So a lot of these statistics you might have seen before, and I should say that I've referenced some, but if there's any of these statistics you'd like to know the reference for, come and speak to me afterwards and I'll share those with you. When we talk about productivity, in days lost due to mental ill health, this is significant, really significant figures here, 12 billion working days every year lost to depression and anxiety alone at a cost of $1 trillion, and that's rising. We've also seen the impact of societal costs, and also a recent study led by WHO, which was looking at a synthesis of 7 mental health investment cases, and we'll look at one in a second, showed that the economic burden could be up to 1% of GDP. These are really large figures, and I think when we're talking to Treasury's finance ministers, these are the types of arguments that we should be making as advocates. So what does that look like in terms of return on investment then? So WHO and UNDP have done a number of very good investment cases with special initiative countries. Ukraine is a special initiative country, I believe. This was one of the earlier ones, so the Philippines. It's sort of within the same income, World Bank income group bracket as Ukraine, slightly larger economy and larger population, but I think it's interesting to look at. And the real figure here that I think was worth noting is the $4.27 billion. So over a 10-year time frame, that's the type of return on investment for the country. This is really significant alongside the physical and mental health outcomes that we just looked at. We're looking at economic outcomes as well. And I'd say this is an excellent investment case to read as well. A slightly smaller country, smaller economy and population is Liberia. This is an investment case that we did a couple of years ago working with the Liberian government, and there's lots of figures on here, so don't worry if you're getting blinded by figures. I've circled the ones that I think are most important, and that is with an investment of $2 per capita, which will be similar to the Philippines investment per capita over those 10 years. The accumulative spend over a 10-year period would be just over 51, nearly 52 million dollars, and the return being nearly 170. So we're seeing really significant returns on those investments. And here we suggested to the Liberian government that there would be a phased increase. We're not looking for governments to go from 0 to fully funding their national mental health policies overnight, but a phased increase, which is then sustainable for the countries. And the 2 extra figures I've highlighted there, one is on the percentage of the health budget that would take, and $2 per person, looking at sort of a general linear progression of the Liberian health budget over that time, would be 11.5%, which I have to say the health financing unit in the government sort of jumped at because it's such a significant increase. But actually, if we look at that as a percentage of total government expenditure, it's more like 1.8%. And a lot of what I've heard today is about the responsibility to deliver good national mental health policies is not the sole responsibility of the health ministry, and there's a lot of other players across government that are needed to not just invest in it, but to deliver. And so when we were talking to the Liberian government here, we were talking about cross-governmental expenditure. And I've also heard today about it's really important having that leadership coming from the highest level. And I think that also is incredibly important when talking to finance ministries and other parts of the government about why this is a shared responsibility to then get the best results. So those are a few thoughts on sort of where we are in terms of the landscape for mental health financing at the moment, and then the potential impact for physical, mental, and economic outcomes for a country. It would be remiss of me to not promote the Global Mental Health Action Network. This is a network that United for Global Mental Health helps to run in terms of we run the Secretariat. And if you want to have more discussions about financing mental health in Ukraine, but also across the world, or other issues such as child and adolescent mental health and climate change, this is an excellent network to tap into, and you can join at gmhan.org. Thank you very much for your time today, and I hope that's a good finish to the day.
Definitely, yes. Thank you so much.
Thank you.
Дякуємо надзвичайно.
Thank you so much, James, and thank you so much, everybody. Applaud to yourself, because the first day of the forum on mental health can officially be at least the official portion of that over until you run away. A few things about tomorrow and the day after tomorrow, and I'm hopeful that everybody has registered for a workshop and the panels for day 2 and day 3. If not, the QR code's there and the pages, you can also register, and if you haven't done so already. Yet again, a few words about tomorrow. Tomorrow, not only here, we will have different events. This is a please follow the things, and in this hall, you will be waiting for a wonderful marketplace. This is why during the day, please visit that, and please have a look that this is sort of like a presentation of a different company's organization, and I'm sure that you will all be interested to get yourself familiar with the activities of different companies, of different organizations that are working in the mental health. This is going to be tomorrow, so please do visit. And then, for the ones who likes, you can start the day from yoga. We are welcoming everybody who likes it, and maybe professional yogais from 8:30 in the morning till 10 in the morning tomorrow in the hall number 3. It's on the 2nd floor. The day will start from yoga, and I think it's a wonderful day of the day, the start of the day of the day 2, and then working in the workshop and the sessions. Therefore, look for, be active, and tomorrow, hopefully that you will open up as much as possible and everything that you have collected. As for today, you will be actively bringing up, using, and bringing to your friends at the workshop. Thank you all so much, and glory to Ukraine. Glory to heroes.